Thank you all for joining us this morning for this as the first day of our joint appropriations hearings for the 2021 session. Thanks to you who joined us in person. Thank you more to those of you who joined us online. Members, I take this opportunity just to remind you to please sign in via the way you were emailed so we know that you are here and present. At this point in time, I would like to ask the Dean of the House and Dean of the Legislature, Representative Smyrie, if he does not mind leading us in an invocation.
Thank you, Mr. Chairman, Chairman Blake and Chairman England. We got a lot to be thankful for. We're living in perilous times, and I think it's a good thing that we invoke the Lord's name. Our Father who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done. Heavenly Father, we come today asking that your will be done. Bless our deliberations and our proceedings. Bless our coming and going. Heavenly Father, I pray for peace on earth and goodwill toward all men and women. Heavenly Father, we ask that you continue to keep your arms around us as we take on the people's business here in the people's house, representatives and the state senate. Heavenly Father, we thank you for all the many blessings. We thank you for safe travel. We thank you for our coming and our going. So we ask that you continue to be with us as we continue to do our work. It's in your name we pray. Amen.
Thank you, Representative. First, let me say thank you to a few people. Martha Wigton and Melody Debussy, thank you for the work you put in. This is a much different hearing than we normally have. Appreciate the staff and the efforts they've put in to make this work today. And also a special thank you to the House Media Services Office, Michael, Justin, DJ, and Betsy. This would not have been possible without your help, and appreciate you working across the building with the Senate side to make this work as well. Appreciate the joint efforts of everyone involved. With that, I would like to hand it over to Chairman England for a few comments.
Good morning, everyone. I'm used to having a room full. When I say that, it always echoes back pretty good, but we are small in numbers in person, and that is quite all right. Just a few housekeeping things. Remember that testing is available downstairs for members, and you're expected to be tested if you're going to be here in the building this week. Testing runs until 11 o'clock today, and then Thursday morning as well from 7 to 11. While you're in the room here, we would ask that you would silence your cell phones because most all the presenters are going to be virtual. So we don't want any interference that would cause us an issue there. If you have questions for the presenters and you are online, please use the chat feature in Zoom. And those members of the committee, you've gotten your login to use Zoom. All others watching are using the streaming service, but the members that are logged in, please use the chat feature there to ask any questions. We will take as many questions as we have time for. Doing this format, we don't really have the ability to run long like we have done in the past when we were in person, because folks are of course keyed up and waiting in the holding room on Zoom. So we're going to have to try to stay on schedule as much as possible. The only other thing is that we would just ask for your patience with us as we're using this new format. If we miss your question or somehow mess up something, just overlook that, because all of this is very new to us. We want this to be as open and transparent as possible to the members and to the public. And we would just ask that you would give us a little leeway if we mess something up. And as far as seating goes here in the room, we will continue to practice the social distancing here in this room and only using those seats that are not X'd off. And our doorkeepers will be helping with that. If you come and go here, we just ask that you come and go. If you're bringing a beverage in, that it has some type of a lid on it, so it doesn't get spilled into the system. Those of y'all that have been around as long as I have, remember a few years ago, we lost one entire side of the room because a cup of coffee had gotten spilled into the electronics. So with all those things said, Mr. Chairman, look forward to working with you and your team and My thank you goes out as well to the House Media Services folks and Melody and Martha for all the work that they've done to make this happen today. So at that, I will conclude my remarks and turn it back over to you, Mr. Chairman.
Thank you, Chairman England. And this time, we should be right on time. I think Wesley Stone is with the governor, and we are ready for Governor Kemp's remarks. Governor Kemp, if you're with us, thank you so much for joining us this morning.
Well, good morning, Chairman Tillery and Chairman England and members of the committee. Can you hear me okay?
Yes, sir.
Well, I know y'all have got a very difficult format trying to do this remotely for many of you all, and I will certainly try to keep you on schedule with my prepared remarks. I appreciate the opportunity to be with you today, and look forward to seeing many of you all later in the day when I get back to the Capitol. Before I begin, I just wanted to take a quick moment to recognize and remember someone who, for the first time in nearly 30 years, is not at the hearings today, and that's Chairman Jack Hill. As you all know, Jack was a true giant of a statesman in our state, and he really, to me, epitomized what public service means, dedicating countless and thankless hours to shepherding the state's budget through the legislative process in good and bad times, as you all know. And he was a man who made time for everyone, listened to their side, held their best interests of the state and its citizens first and foremost in his decisions that he made. And like to so many of you, including myself, he was a mentor and a role model for all of us under the Gold Dome, and certainly he is still missed. As I mentioned last week in my State of the State address, when I came before you last January, none of us could have envisioned what 2020 would have in store for us as a state and a nation. And I'm very thankful for the work that each of the chambers in the building have done to create such a strong economic foundation for our state. And I believe that last year has truly shown the strength of that foundation, which underlines our economy here in the great state of Georgia. And while last year's interrupted legislative session may not have gone like we had expected, I'm really appreciative of the close working relationship that we built over these difficult months as we work to cooperatively guide our state through some very difficult waters. In particular, Chairman England, Chairman Tillery, I appreciate the many long hours that each of you, as well as your staff at the House and Senate budget offices, spent with my staff at OPB in crafting the current 2021 budget, which has put us in the strong position that we find ourselves in today. Georgia has a long history, as you all know, of conservative fiscal management, and as a result, last year when we saw revenues begin to slow due in part to the economic softening abroad, we took proactive steps to reduce spending in our budgets to hedge against uncertain times. Little did we know at the time that those proposed reductions would better position us to make even more difficult choices as the year progressed. And due to the unprecedented crisis facing us in our last legislative session, as you will remember, I authorized the use of $100 million in revenue shortfall reserves for the amended 2020 budget to be used for COVID response efforts, and an additional $250 million in RSR in the 2021 budget to mitigate further potential budget reductions. Even still, in April and May, we projected that we could end the fiscal year with nearly $1 billion shortfall. Instead, thanks to the financial assistance from the federal government and through conservative fiscal leadership, we were able to return the entire $100 million in the RSR funds to the amended 2020 budget. In the amended 2021 budget before you today no longer relies on the $250 million in RSR funds to balance that budget. And while our final revenues came in moderately under what we had estimated in January of last year, we did avoid the dire deficits predicted, combed the budget to find any possible savings, and ultimately returned $534 million of unspent money to the Treasury that helped offset revenue declines. As a result, instead of ending 2020 with $1 billion deficit, prior to this year's K through 12 midterm adjustment, we will have added more than $150 million to our reserve fund balance. Because of our proactive steps early on, we were able to accomplish this with no last-minute additional budget cuts to state agencies and no furloughs for state employees. And before I get into the details of the budget proposal, I'd like to take a minute just to recognize all our state agencies and their employees who have worked tirelessly throughout this crisis to directly combat COVID-19 to preserve the fiscal health of our state and continue to provide critical services to our citizens. They have done this, as you all know, in an environment where their budgets were reduced by 10% due to the very crisis that they are combating. Yet many of our agencies have found creative, innovative solutions to manage those budget reductions while continuing to provide the same or even greater level of service. As many of our agencies have implemented remote working to combat the spread of COVID-19, they also have used the new work model to restructure their own premise working space, many times saving hundreds of thousands of dollars in real estate rental cost. We are fortunate to work among such dedicated public servants, and I'm grateful to them for the work they do each and every day on behalf of the citizens of our great state. As we look ahead to the second half of fiscal year 2021 and the fiscal year 2022, I'm optimistic that the strong economic foundation we have built together will continue to support our robust recovery as we remain the -1 state in which to do business. The budgets before you will help drive that economic recovery by restoring resources to our K-12 and higher education school systems to develop a skilled and labor-ready workforce, continuing to expand and maintain our critical transportation and logistics infrastructure, and providing financial assistance to rural communities to support innovation and economic development in all parts of our state. As you all know, Georgia's greatest strength lies in our people. Providing our hardworking Georgians with access to high-quality education is essential to equipping them with the foundational skills necessary in a 21st century workforce. Many well-paying career track jobs now require some form of post-secondary education, so we must ensure that our citizens have affordable access to higher education. Due to the uncertain economic conditions during the spring and summer, the original 21 budget did not include funding for enrollment growth for the Board of Regents or the Technical College System of Georgia. Both my amended budget proposal and the FY 2022 budget now fully fund that prior year growth in addition to funding the new enrollment growth for 2022. Doing so ensures that our higher education systems can continue to provide students with the most up-to-date skills that they need to succeed in the workforce today. Due to the success in our university and technical college systems, every student must have a solid educational foundation, and as you all know, that begins in our K through 12 schools. And while the economic uncertainty that we have, along with every other Georgia family, faced last year required making reductions to the budget across the board, funding for education and supporting our state's teachers remains a priority of my administration. We recognize the difficult and unprecedented environment that our teachers face today, but they remain committed to their mission of educating their students and developing our young people. My administration continues to remain committed to them. Therefore, this budget provides more than $647 million in the amended FY 21 and $573 million in FY 22 for K through 12 education, fully funding enrollment growth and holding individual schools harmless in the current fiscal year for any reductions in their enrollment that they have had this school year due to COVID-19. I know that is a concern that I've heard about, and I know you have as well. I'm confident that these restorations, combined with the more than $2.1 billion in assistance our local school systems are estimated to receive through the Federal Education Stabilization Fund, will ensure our teachers and school systems have the resources they need to continue to provide every Georgian with a world-class education, even amidst the challenges of COVID-19. But as our labor-ready workforce is the backbone of our economy, Georgia's expansive transportation network is its lifeblood. Our seaports, rail, highway, and airports allow companies quick and reliable access to both national and international markets, attracting businesses from all over the world to Georgia. Properly maintaining our existing infrastructure while also expanding to meet the future needs of our state is critical to sustaining and accelerating economic growth. My budget adds nearly $200 million in both the amended 21 and FY 2022 budget to the Department of Transportation for roadways, including $38.8 million for the State Road and Tollway Authority, which will enable the authority to leverage more than $500 million in future guaranteed revenue bonds to further expand our toll system and relieve congestion on our busy interstates. The budget also authorizes $110 million in general obligation bonds for transportation, including $100 million to continue working and repairing and replacing bridges, and $10 million to continue upgrading our more than 1,000 miles of short line rail to Class 2, both of which are vital to our manufacturing and agriculture industries, which allows them to quickly move their products to the market. By promoting growth and prosperity in every corner of our state, it's essential for Georgia to keep that is essential to keeping Georgia's economy strong. COVID-19, as you all know, has highlighted both the unique opportunities and challenges of rural Georgia. Many of the economic, medical, technological, and infrastructure-related obstacles facing rural areas are best addressed through targeted, innovative public-private solutions tailored to the specific needs of that individual community, rather than a one-size-fits-all government program. Rural Georgia needs long-term investment that creates sustainable solutions to meet the needs of their communities today and for years to come. That's why this budget provides nearly $40 million for the One Georgia Authority in FY 2022 to establish a rural innovation fund to provide a ready pool of resources that can support these innovative, targeted solutions to enable our rural communities to build sustainable solutions to the challenges they face. Additionally, as a result of COVID-19 and the shift of many employers to greatly expand telework options for their employees, more Georgians than ever can now continue to work in their current profession while taking advantage of the space and low cost of living in our rural communities. A remote workforce also allows employers to greatly expand their recruiting pool, enabling them to create jobs in rural areas without having to physically relocate them. However, to fully take advantage of this shifting work dynamic, along with expanding telemedicine and online learning access, rural communities must have reliable and robust internet capabilities, as you all know. Therefore, this budget includes $20 million in the current fiscal year and an additional $10 million a year going forward to establish a broadband infrastructure grant program. Thanks to your support in funding the mapping project at the Department of Community Affairs, we have a better understanding of which areas are underserved, and this funding is the next logical step as we see the public and private sectors working together to address this long-time issue in rural Georgia. Finally, protecting the health and well-being of our citizens, as you can imagine, continues to remain a top priority of my administration. This budget continues to ensure healthcare access for our most vulnerable citizens by providing more than $329 million for Medicaid and Peach Care to fund projected needs in the upcoming fiscal year. This budget also continues my promise to expand access to affordable and quality health care, thereby increasing the number of our citizens who have access to health care insurance. Uncompensated care and expensive emergency medical services increase the cost of health care for all Georgia citizens and our employers, which limits employers' abilities to expand their business or raise wages for employees. Therefore, my FY 2022 budget includes $76 million to implement the Patients First Act, which will increase access to health insurance for the first time to thousands and make it more affordable for millions more. Finally, speeches like these often spend a great deal of time focusing on what we are doing with new money. But the hallmark of a true conservative fiscal management is using the resources that you have to do the greatest good possible. In addition to those items that we are able to restore or fund through our revised revenue estimates, we are doing more with what we already have. This budget provides for an additional 100-person trooper school for our Department of Public Safety to ensure we maintain a robust state police force. It also provides a 10% pay increase for every correctional and juvenile justice officer using existing resources within our correctional systems. These employees face some of our most difficult working conditions on a day-to-day basis while they work tirelessly to keep our citizens safe. In this past year, they also faced the additional threat of COVID-19 within the facilities they are charged with protecting. So I'm pleased we were able to recognize and reward their hard work simply by better managing the positions and budgets that we already have. We also are directly reinvesting savings realized through the increased emergency FMAP as a result of the public health emergency back into our behavioral health and foster care systems. The amended budget reinvests more than $28 million in FMAP savings into our state hospitals and to community services, and $3.5 million into adoption services to help address the needs of some of our most vulnerable Georgians. And we are leveraging $20 million within the Department of Transportation to improve freight infrastructure to address efficiency and safety, and for our broadband and rural development initiatives on rural highways, which is crucial to our economic efforts. Again, I'd like to thank you for the opportunity to be here this morning and share some of this great news that I feel is included in these budget proposals. While Georgia, like every other state, has faced unprecedented challenges over the last year, our strong conservative fiscal leadership has positioned our state to emerge from this crisis stronger than ever, with a solid economic foundation that will keep our state moving in the right direction. I want to thank you for your consideration of this budget recommendation, and as always, your continued partnership as we battle and fight COVID-19. Much of our efforts around long-term care facility support, testing, augmenting staffing, vaccine distribution, and school employee supplement funds will be discussed by other agencies in their presentations as part of their distribution of federal funds through the CARES Act and our ongoing partnership at the state level to ultimately win that fight. Again, to both the chairman, the members of the committee, I want to thank you for your time this morning. I look forward to working with you this legislative session as you all do your part in helping balance our budget and bringing that to fruition. I look forward to working with you to continue to keep Georgia safe, strong, and healthy, as well as prosperous in the days ahead. And I again just want to thank you really over the last year for your unprecedented cooperation working with myself and our budget director, Kelly Farr, and the rest of our team as we addressed a very difficult situation in our state, not only medically, but economically. I wish you the best with the rest of your hearings, and I look forward to continuing this conversation. Hope you have a great day, and God bless.
Thank you, Governor. Thank you for joining us this morning. We appreciate your time. And I also want to echo, we too appreciate the camaraderie that your office has given us through Director Farr and your CFO to work out some things even before your budget came out. So thank you so much for that. At this time, I kick it over to Chairman England.
I want to echo the same to you, Governor, as well. And thank you for the working relationship that we've got with OPB and your office. And Lord willing, we're going to get through this, and know that we pray for you and Miss Marty and the girls every day as well, as all of our leaders. And just thank you so much for being with us this morning.
Y'all have a great day. Thank you.
All right, so thank you. One other housekeeping note for the members, and I failed to mention it in the beginning there, was that only committee members are going to be allowed to ask questions as we normally do. We have so many committee members between the House and Senate that it's impossible to allow others to ask as well. But if you are someone that's listening, you do have a question, you're not on the committee, you're more than welcome to text your questions to someone that's on the committee and see if they don't mind asking them for you. Just that little housekeeping note, Mr. Chairman.
As we now are done with the governor's presentation, we'll move next to the economic outlook and revenue estimate by Dr. Jeffrey Dorfman. Dr. Dorfman, are you with us?
I am, yes. Good morning, Mr. Chairman.
Good morning. Yours.
Thank you very much. Thank you for inviting me to testify to the Joint Budget Committee this morning. Thank you for allowing me to appear virtually. And also a thank you to the legislature for your quick action last year's session to pass the Marketplace Facilitator Law, which turned out to be very handy as we began a pandemic shortly after you passed it, and we all started shopping online an awful lot. So that definitely helped keep our budget in good shape. I will ask your indulgence this morning testifying this way. I am not controlling the slides, which is probably a good thing in terms of internet security, but I will have to occasionally ask for the slides to be advanced. I will echo Governor Kemp's words that sessions like these always make us remember Chairman Hill. I've very much enjoyed working with Chairman Tillery since he took over, but Chairman Hill and I, since I come from a background in agriculture, go back 30 years to long before I was a state economist, and I'm sure we all miss him, but Chairman Tillery is doing a great job filling in, and I enjoy working with him and Chairman England when I get the chance. So if we now move to the next slide, I will try and keep my presentation to between 10 and 15 minutes. So there should be plenty of time for questions from members. I begin here with this overview of the Georgia labor market. You can see that we had about 4.6 million employed people before the pandemic, and that dropped by about 500,000 people in April as we went into lockdown, and now has risen back to about 4.5 million people. So we are short. As you can see, there was 123,000 jobs from November to November. We don't quite have the December numbers yet. We'll have them soon. The interesting thing about this is, first, that's a pretty good recovery to only be short 100,000 jobs now, and that is due partially to Governor Kemp's reopening the economy, and also a lot just to the ingenuity of business owners in Georgia who figured out a way to get business done even during a pandemic. The second thing I want to point out about this is, based on national data, there has been a huge decrease in part-time employment among people who work part-time by choice. So we classify part-time workers into two categories, by choice and those who what we call for economic reasons, meaning I'd like to work more hours, but my boss won't give me any because he doesn't need me to work more hours. So Georgia appears to have lost about 113,000 jobs that were part-time by choice, which almost exactly matches the number of missing jobs we have. Those jobs tend to be either high school or college students who are only working some part-time hours for spending money or to help pay their education expenses. So they don't want to work full-time, or parents who are working part-time by choice so then they can take care of children when they get out of school. So it makes perfect sense that those jobs would be gone in a pandemic when I suspect in a lot of households, high school or college kids have been told, maybe mom and dad will help you out with some extra spending money. We don't need you risking working a job right now. And when parents who take care of children at home have had to perhaps spend more time at home taking care of children that are doing school online. That suggests that really our labor market is about as fully recovered as it can be until the pandemic is over. Let's go to the next slide now. This shows US personal income. And the interesting thing you can see here is the first 3 bars on the chart show January, February, March, so before the pandemic really took hold. And you can see that actually since the pandemic began, incomes in the United States are actually up. In fact, we're up about 2.9% over the last year. And that is because the federal government has passed out so much money in various types of aid, mostly under the CARES Act, that we have actually more than fully replaced income lost when people could not work. So we've never had a recession before where people had more money to spend than when the economy was growing, but we're doing it now. And this has implications, obviously, both for sales tax collections and to a certain extent for income tax collections, as I'll discuss more, because we get income tax withholding on unemployment insurance. And so those $600 bonuses in 2020 and the new $300 bonuses that are starting now, the state of Georgia actually collects a fair amount of income tax withholding on those unemployment payments. So the fact that people actually have more money than they did before is one of the reasons that state revenue has held up as well as it has. Next slide, please. This shows US retail sales. And you can see, again, you can see the decline as we went into lockdown, half of March, all of April, and half of May. And then you can see how retail sales recovered quite nicely when we reopened. And there are changes in categories within retail sales. We are spending more on food at home and less on food from restaurants. We are spending more on home improvement projects and furniture, and much less on things like suits and ties like I'm wearing this morning, but certainly have been wearing less than I used to. So some stores have won and some stores have lost, but overall, consumer spending has held up quite well. This has helped our sales tax collections. We are up 0.4% fiscal year 21 to date. But if there hadn't been an audit that led the state to give extra money to local governments earlier this fiscal year, our state sales tax collections would actually be up about 8%. So consumer spending has actually held up quite well. And again, this is supported by all that money that the federal government has been providing. Next slide, please. Sort of completing our view of how this is a very unusual recession in terms of consumers doing pretty well financially. This slide shows the savings rate. This is as a percent of households' disposable incomes. You can see here that we were in the 7-8% range before the pandemic started. That went up to 33% in April as people got the $600 checks, and most people who hadn't lost their jobs simply saved that money, and then slowly declining, but still up at about 12 or 13% today. This is an incredibly unusual recession in that people's savings has gone up. People's credit scores have actually improved on average during the pandemic, and credit card debt has declined significantly during the pandemic. So the good news is that our citizens have been very financially responsible, have generally done the right thing and saved a lot of this extra money that the federal government has given them if they didn't lose their jobs and so didn't need the money. And the fact that credit card debt is down, our credit scores are up, and our savings in the bank is up, all mean that when we've all been vaccinated and we have the pandemic under control and can get back to whatever will become normal after this, that our economic recovery should be quite strong and swift because people have the money to spend and are just waiting for the chance when it is safe to do so. Next slide, please. We hear a lot about eviction moratoriums and renters not paying and whether there'll be a lot of foreclosures, but this is data on rental income as reported by landlords. And you can see that rental income had a little bit of a dip into May and June. So it doesn't happen right at the start of the pandemic, probably because people used the savings they had at the start of the pandemic to pay their rent initially, but as they started to run out, perhaps while they hadn't gotten the $600 checks or their unemployment insurance bonuses, fell behind a little bit, but it has recovered nicely. What I'm hearing from landlords and in the data is that at the start of the month, there is an increase in people who don't pay on time. But by the end of most months, almost everybody does in fact pay their rent. So I don't expect we're going to have any sort of crisis like we did back in 2007 and 8, where we had lots of foreclosures or lots of problems with renters getting evicted. Again, just another sign that really the economy is doing quite well. If we can just get the virus under control, things will be fine. Next slide, please. Moving beyond sort of current economic conditions to longer term trends, I just want to provide a little caution to the legislature. We in Georgia have gotten quite used to having a very strong economy with revenues growing quickly and just thinking, oh, we'll have an extra billion or billion plus in state revenue collections to add to the budget and spend every year. But we can't count on that in the long run, because one of the drivers of our strong revenue growth over the decades has been population growth. Georgia is a great place to live, and a lot of people have moved here. But that has slowed down. You see here, these are decadal population growth. So in the 1980s, Georgia's labor force grew 30%. We were growing almost 3% per year, slowed down a little bit in the 1990s. But you can see the 2000s, the 2010s, and the projections for the 2020s. So that last slide is just, that last bar is just a projection. But we're now down to growing under 1% per year in terms of labor force. Our projection for the next 10 years is that the number of workers in Georgia will grow by 0.8% per year. Population is growing a little faster than the labor force because we are attracting a lot of retirees. But to be richer, we need workers. And so this is just a caution that we may not be able to grow as fast as we did back in the 80s and 90s unless we can convince more people, particularly working age people, to move here. That concludes the presentation part of my testimony today, and I am happy to take any questions that you have.
Thank you, Dr. Dorfman. Thank you for your outlook and your picture. I must tell you that you have been a lot more rosy than me, but you've also been a lot more right. So I have to give you credit for that as well. My question is twofold, really two questions in one. The first being, can you explain to us in less than the slide presentation you've already presented why Georgia revenues have held up so well? And then the last part of that would be, when does that joyride end? When do you see that coming to an end?
Sure, and thank you for the question. And Director Farr will talk more in his testimony about why we think that revenue has held up so well. But the short answer is that the federal government has passed out a lot of free money, and that has held our sales tax collections up. Withholding on the unemployment benefits has helped hold our income tax collections up. As I pointed out, a lot of the jobs that are lost were part-time jobs, so it wasn't much income lost. And so that also helped state tax collections. And frankly, I think we need to put a lot of credit where it belongs. Business owners in Georgia, small and large, have done a tremendous job at finding ways to still carry out business and keep their businesses operating during a pandemic. You know, whether it's curbside pickups, takeout for restaurants that pivoted and started selling meal kits or ingredients. Just, you know, the ingenuity of Georgia citizens has really helped us. And in terms of, sorry, the second part of your question, in terms of when when we may have to deal with a reckoning. I think the pent-up savings and the coming vaccines will carry us through 2021 for the most part, certainly through fiscal year 21. And that perhaps in the second half of fiscal year 22, we may start to see some fallout of businesses that struggled some during the pandemic, managed to hang on through things like the Paycheck Protection Program. But with the, with the vaccine under control and federal largesse assumedly coming to an end at some point, we may see some business failures sort of in that second half of fiscal year 22 as we really shake things out and figure out who really survived and who just hung on.
Gotcha. We got any questions from the members? Senator Watson.
Thank you, Dr. Dorfman. Appreciate that. Just for my education, to help me understand you had said the population growth for workforce is reduced, yet the retirees may be up. So are you suggesting, and this is the meat of the question, does that mean that we have less revenue from the retirees than we do from the workforce? I would think that would be the case, but I just wanted to hear your thoughts on that.
Sure, and thank you for the question, Senator. Yes, that's correct. So retirees who move into the state of Georgia, we get some revenue collection for the state through sales tax, but not much else. The legislature has treated retiree income fairly favorably in the past, shall we say. So we don't collect a lot of taxes there. So we're just really getting their consumer spending. Whereas when we have labor force, we are getting income tax and the sales tax. And assumingly they're working for businesses and those businesses are earning profits and paying corporate tax. So the state gets much more in taxes if you can encourage a 30 or 40-year-old to move here and take a job than if we encourage a retiree. Also, as the governor said, and it's very important, we can't stress this often enough, Georgia remains, it has been for a number of years now, the #1 state in the country in which to do business. The governor and his team have hardly missed a step during the pandemic. We have continued to attract new businesses to Georgia with announcements pretty much every week about new factories they're going to open. And we can't keep that up if there aren't workers to take those jobs. If all the new companies just have to steal workers from existing Georgia businesses, then those existing businesses need new workers. So really, if we're going to continue to grow and attract the companies that we have been so successful at attracting to Georgia, we need to grow the labor force so we can provide workers for all those jobs that want to come here.
I think we've got
Chairman,
a question
do you want me to
online.
do you want me to take the online questions?
I think Chairman England's going to read those, and we'll kind of handle it as formal of a format as we can.
Okay, Dr. Dorfman, this is from Senator Larry Walker. Do you anticipate larger than usual income tax refunds as a result of the enhanced unemployment benefits? And how will this impact our budget?
Yeah, thank you, Senator. That's a great question. So I don't actually particularly anticipate larger refunds due to the unemployment benefits in that withholding is voluntary. The people have to opt in, and about 75% of Georgians have opted into withholding. So there may be some refunds, but there'll also be some people who didn't withhold who will owe us a bunch of money. But I do anticipate large refunds this year. One of the things that we need to be very cautious about, in fact, is just that. And the reason is, imagine that you worked 10 out of the 12 months. So you had 2 months when you were unemployed. The way withholding tax tables work, they take your monthly income and they assume you earned it all year. And so people who have withholding done on a monthly basis will potentially have too much money withheld because they didn't really earn that annual amount if they were missing a month or two. And so we are very concerned that there will be large refunds in February, March, and April, and are anticipating in our projections a rather lean tax filing season.
Okay, we've got another one from Representative Carolyn Hughley. Do you have more information regarding the experience of landlords? Were there any areas that had a more unfavorable experience than others? I guess geographic areas of the state where that played out more so than others.
Yeah, that's another excellent question, but unfortunately, I don't have a good answer for that one. The data we have just isn't detailed enough. So it's really nothing but anecdotal at that level. I do expect there probably is some of that going on, but for the most part, I think particularly we do have some rental assistance coming in the latest relief package, and I suspect there'll be some more. I think for the most part, we will be okay. There will obviously be some hard luck stories, I'm sure, and already have been some, but I don't think it's going to be terribly widespread. I'm sorry, I can't answer in any more detail.
Okay, and from Chairman Robert Dickey, in light of all the positive financial metrics you have shared, why do you say that we are in a recession?
Sure, and thank you for that question, Mr. Chairman. It is always great to get a question from a parent of one of my former students. The way economists define recessions is by economic output. And so we have produced less during the pandemic because some businesses have had to remain closed, right? Six Flags is closed. Concerts are closed. We can't have fans in the Mercedes-Benz Stadium or State Farm Arena, or more importantly, obviously, Sanford Stadium. So the fact that some businesses have not been able to operate, a lot of restaurant and bar business is down, hotel business has been down. This reduces GDP. The way economists define this, it doesn't actually matter whether our income is up or down. What matters is how much stuff we produce. So we've had during this pandemic less stuff, but more money.
Okay. Representative Roger Bruce is asking, are you aware of new business ideas that have come about as a result of COVID-19? You were kind of alluding to that a little bit ago, some of the adaptions that restaurants and such have made. And his example is 1 year ago, no one knew about Zoom. Are there any other things that you've noticed pop up that are in that category that we didn't know about 12 months ago?
Sure, I think we've seen an increase in online educational offerings. We've seen fitness studios, gyms essentially go online. I mean, it's not just Peloton and fancy expensive things like that, but I know a local gym here in Athens that did a lot of personal training that closed their gym and now has launched an online training service where you pay a monthly subscription. You can talk to their trainers online, and they post videos that you can just watch and sort of follow along. So I think we've seen a lot of things like that. I know tutoring has gone online, and I think there's a lot of other stuff that we'll sort of see as we reopen. We'll see what businesses have learned and what becomes permanent versus what, I hate to call it a new business when it's been done through necessity now. It may not be a money maker. It may just be that it loses less money than if they didn't try it at all. So we'll wait and see what's permanent once we get through with the pandemic.
The resiliency of the American entrepreneurial spirit is the way I kind of think of it. So Chairman Ed Setzler, Georgia has carefully managed through COVID-19 safety while keeping its economy running at a high level. Can you compare and contrast Georgia's economic conditions for the past year with a state such as California, which largely shut down its economy?
Sure, and thank you for that question, Mr. Chairman. So I don't off the top of my head know the numbers for California, although they certainly are worse than ours. I can tell you that Georgia, there is what is called a recovery tracker that CNN and a group of economists at Harvard called Opportunity Insight have put together that measure how different state economies are doing in terms of reopen and recovery. Georgia does rank several percentage points above the national average in that. And in a figure that I saw a week ago, Georgia was ranked as the #4 state in terms of sort of recovery and resiliency and how close to normal we were in economic recovery. So we have done very well. There's no doubt about that. And I know California has done worse, but I don't know exactly how much worse.
Dr. Dorfman, that's all the questions we have that came through online. Are there any other questions from members here present in the audience? Seeing none, thank you, Dr. Dorfman, again for your report, and appreciate what you do for our state.
Thank you.
At this time, I believe we have next Commissioner Toomey, but we're actually running a little bit ahead of schedule. I'm not sure if Dr. Toomey is with us yet. Dr. Toomey, are you online? Looks like we're a little bit ahead. Mr. Chairman, if it's okay with you, we'll take about a 5-minute recess, allow members to use the restroom, grab a bottle of water if they'd like to, and we will be back on just before 10 o'clock. We're checking to make sure she's in. Committee will come back to order. We're waiting just a second to get Dr. Toomey online.
Good morning. Is this a good time to begin?
Hey, I think we've got you online now. Dr. Toomey, thank you so much for joining us this morning. The floor is yours now. Members, please take your seats as we hear from our Commissioner of Public Health.
Thank you very much for giving me the chance to talk to you about the work we've been doing on COVID-19 and our coronavirus response. It's hard to believe that a year ago, when I first addressed you for the first time, we were just beginning quarantine stations in the airport because we were recognizing the first cases of coronavirus in the world, potentially coming to the US, first identified in Washington State. And, you know, look, there's been so much that has happened since a year ago that none of us, I think, could have predicted, and the impact on the state and the toll on our population is just unfathomable. And I really want to thank all of you for your support and ongoing willingness to work with us to ensure that we have the best response we can have in our state, because this is probably the single most important thing that public health will ever do in this century. And it's just extraordinarily important that we are successful because of the magnitude of the lift. I wanted to go through, you know, some of the background on what we have done and actually spend a fair amount of time on our COVID response, because I'm sure that's foremost in your mind. And then we'll get to our budget. We have few changes on our state requested funds, but I know you have a lot of questions about vaccines, and I want to be able to answer your questions if I either through my discussion or through additional questions afterwards. Moving to the first slide, I just want to remind everyone what our structure looks like, because it's quite unusual. This is not a typical structure of public health in states. Many states have county health departments that are directly connected to the state health department. Our state office is directly connected to district offices with district health directors, physicians who work directly for me. So there are 18 positions that report to me, district health directors, but 159 independent boards of health that report to the health director, who serves as the CEO. So there's this ambiguity around kind of direct control of the county health departments. And so I think there has been some discussion about has that had an impact on what we've done? And I really am very proud to say that we have been working very diligently to ensure that we are working as a unified team as best we can, despite the fact that not only is the structure not completely conducive to a unified command system, but also that every district is different. They have different IT capacities, they have different needs and opportunities for their populations they serve. Certainly Metro Atlanta is very, very different than North Georgia or Waycross area. But yet within that framework, we have never worked so closely together with the health directors. And I think that they too will just tell you, if you talk to them in your home district, you know, that we are making every effort to work together as a team in sync, even though there's different capacities throughout the state. You know, I know there's a lot of question about scheduling, for example. That's something that we've recognized that it was left to the districts and for testing. And now we are moving to centralized scheduling just to increase capacity throughout the state. So these are the kind of things that we are working on together, and we can talk more about it as we get through the presentation. I do want to just comment, and I'm sure you're well aware in the next slide, that our case counts are increasing significantly, as they are throughout much of the United States right now, particularly severe in places like Southern California. What we have seen is, since the first 2 cases were reported on March 2nd, which seems like eons ago, that we are continuing to see an increase, saw a decline with the shelter in place, then again an increase in the summer months, and then another decline, and then post-Christmas and Thanksgiving, a continuing increase. I've been asked many, many times, why do you think that is? I think a lot of it has to do with people are just tired. People are tired of talking about this virus. People are tired of having to wear a mask. People have COVID fatigue. And I'm well aware of that. And I know young people really don't take this very seriously. They think that they really won't get sick. It's not something that will hurt them. And yet they are often the ones who will bring the virus home into the family and potentially infect their parents or grandparents. And so it's just extraordinarily important we continue to get the message out that I've been saying really for months and months now. Wear a mask, social distance, follow the guidelines for prevention, wash your hands. And now also with the new variant, we know and we recognize that the virus is even potentially easier to transmit from person to person than it was before. And so I think this message of continue to please follow the guidelines and wear a mask anytime you're in any indoor space with other individuals, whether it be like right now in our conference room with my team, or out shopping, or even with your family with whom you're not always together. We have to take those precautions until the prevalence comes down in our communities, and until we can get everyone vaccinated, because that is our single most important tool we will have, along with continuing to wear a mask to bring this virus to a halt. I did want to say that our response and the next slide, the strategies we used, were based on CDC guidelines. We have worked very, very closely with CDC. Most of my epidemiology team have been trained at CDC. Many came from CDC. And so we are really very, very fortunate to have such a good team in place. And we had a multi-pronged effort to try to quickly identify individuals, isolate, quarantine, and now make vaccine widely available as we roll out our plan. Our surveillance system is used for tracking. Many labs were engaged, not just our own public health lab. We had to do that because of the volume of testing. We had at one point 188 test sites that were up and run by public health, in addition to any private sector facilities that may have had sites as well. And so to be able to do that, the magnitude of that testing, we had to partner with private laboratories and private sector companies for that testing, and are continuing to work closely with all of our hospital partners and other primary care partners to be able to get the information from testing, because there's additional testing throughout the state, including antigen tests. I'm looking right now at our COVID dashboard. I urge you to look at that daily if you're interested in just seeing the day-to-day change. Although I think the trends are more important than just a day-to-day jump in numbers, because that can reflect more the number of tests being done and reported. We had to work to develop a way to have the outside laboratories, including from some of the urgent care centers, whether it's Piedmont or Peachtree or any of the places that are doing antigen testing, as well as the more kind of traditional PCR tests, to be able to report electronically to our laboratory. And all those systems had to be built and developed to be able to function smoothly. And I think at this point, I'll say, and I'll be saying again as we talk about vaccination, the systems we had in place for disease surveillance were state of the art. We really felt strongly that we had and had one of the best surveillance systems in the country. It was developed about 10 or more years ago. It was a software that had been developed in-house and really worked for us. It was never designed for hundreds of thousands of cases. And so, like many things, that work beautifully for tracking 80 cases of Legionella disease in an outbreak, or 18 cases of measles as we had last year, it was not able to easily track and continue to monitor what has now become almost 700,000 cases of COVID. And that's just the confirmed cases. That doesn't count the additional probable cases that are antigen positive. And so that's my first example of how the infrastructure of public health was just not designed for this kind of response. And we have had to use federal dollars and working with foundations as well to try to enhance the ability to continue to collect this data and report this data in the most timely and efficient and accurate way. We talked a little bit about testing, moving on, and our specimen collection points. We have a little fewer number now because we're redirecting some of our efforts to vaccination, but that is continuing because many people find our test sites easier to use in some of the private facilities. Contact tracing was an important component of our response, And early on was probably the primary way we were identifying individuals and trying to stop the spread of disease. This was something that is a key part of disease prevention for many respiratory diseases, including tuberculosis. But because of the magnitude of this, we actually had to ramp up with 1,500 case investigators and contact tracers over a matter of a few months. And I have to say, I have never seen a state government, and particularly public health, be able to respond so quickly and so efficiently to bring these individuals on board and deployed throughout the state to be able to do that. It's harder to do contact tracing when the numbers are as high as they are now, but right now with the emergence of the unusual variant that seems to be more rapidly or more easily transmissible, contact tracing will be even more important, because we will identify those cases immediately and try to stop any further spread where every single case could become a super spreader event simply because of the ease of transmission. And so I don't want you to think, even though we've deployed or redeployed some of the contact tracers to our vaccination efforts, that it's not still important. It's absolutely critically important, and perhaps now more than ever before, as we are recognizing that throughout the United States now, we have several new variants that may be more easily spread, but thankfully are still vaccine sensitive. And the last thing, and the last thing I'd like to say is that about our vaccination program. This has been our primary focus for the last several months. We have been working very, very closely, not only with our health departments, but private sector providers, including hospitals, pharmacies, federally qualified community health centers, and private physicians, and to administer the vaccine. All the allocations come from the federal government, and we have no control over those allocations. I know that that is really confusing, because we need additional vaccine. There's no question about it. But at this point in time, we often don't know from week to week exactly how much vaccine will be available or when it will be coming. With a change in administration midweek, we're anticipating that there may be additional vaccine made available in the coming days to weeks. We hope so. We look forward to that, because we have many sites available. In fact, at this point, we have a total of almost 1,700 providers enrolled. That includes not only hospitals and public health departments throughout the state, but also many private sector physicians and other nonprofits and community health centers. But we don't have enough vaccine right now to give to everyone, or pharmacies. And you may have heard that pharmacies have been given vaccines, at least some. I know Kroger is currently vaccinating in my neighborhood. I know that Publix, Walgreens, Walmart's will be coming on board at the end of the week. The important thing also to remember is that there is a bit of a lag between the time that putting vaccine in arms is reported, and if people don't enter that information into the vaccine management system that in our state is called GRITS, the Georgia Registry for Immunization Transactions, then we don't kind of get credit, as it were, for having given that vaccine. And I think this is really important, because I know many of you have been concerned, and I've gotten calls and have long discussions with many of you about the fact that, for example, this morning when I looked, the New York Times had us having distributed or actually put only 203,000 vaccine in people's arms. Well, I know, because I know what we have done, and we have looked at our own numbers. We have actually given 451,169 doses, most of those first doses, because we're just beginning to move to second doses. So there is some challenge there with how the vaccinations are being counted. We recognize that our immunization registry was not being utilized by all providers appropriately or accurately. We have developed strike teams to help the providers do that, and even help them fill in the additional information. We also have actually reached out for volunteers through Serve Georgia, but also through the med schools, pharmacy schools, and nursing schools to get student volunteers. And many of our vaccination sites have actually been staffed by these students who have just done an amazing job. And it's an extraordinary opportunity to to be part of what is, we hope, a once in a lifetime pandemic and making us successful. The other thing that also isn't well recognized is that 95% of our long-term care facilities actually enrolled in a program where Walgreens and CVS vaccinated both the facilities, the residents, as well as the staff there. And as we had initially rolled out following the CDC guidelines from the immunization practice advisory board, we put long-term care facilities and healthcare workers as our top priority. And so some of our vaccine that was allocated to us was, in a sense, kind of taken off the top and given to CVS and Walgreens for the long-term care facilities. They're almost done, I understand, with that process. And so those allocations won't be taken for the long-term care facilities. And I'm pleased that so many of our residents have gotten vaccinated. But the other point I wanted to make, just for your information, is that in that initial phase, we had tremendous uptake in the long-term care facility residents, but very little, relatively little, 25 to 30%, only 25 to 30% of the staff themselves. And that was the same was true in many of our rural hospitals, both in North and South Georgia. Well, here in the metro area, there was a tremendous demand among healthcare workers for the vaccine. We have very little uptake, and probably closer to 30% only accepted the vaccine. Having said that, we made the decision, and I think it was the right one, to open up the vaccine process to a broader group of individuals that is 65 and under. But in doing so, have an additional almost 1.5 million or more individuals eligible. And so there's been, I know, a tremendous frustration that it's difficult to make an appointment. And that's one of the reasons why we're in the process of rolling out that central scheduling to assist, as well as set up mass vaccination facilities across the state, which we think will help, literally vaccinating thousands of people in a single facility rather than hundreds, as we are doing now currently through various providers. And we're in discussion today, actually shortly after this, to begin to do that fairly quickly. But once again, I just have to say that we have to remember that our allocation is what limits us from doing that, where we would do this everywhere very, very quickly. We have the staff, we have the volunteers, we recognize the infrastructure. We just don't have sufficient vaccine to be able to do all that we would like to do. And so I do want to also make a comment that I know when I talked to Senator Burt, I think he was, you know, I explained that the CDC website isn't accurate, and I said, I don't want to be defensive about that. Somehow there's a, you know, we've done more than CDC is reporting. Right now, I have a team working with the CDC folks to figure out what that is. But also, just the comparison state to state is a little, I think, misleading, because states are so different. Our population is almost 11 million. A place like West Virginia, where I grew up, there's not even 2 million people. And we don't have, you know, so, and there's different issues about vaccine uptake and even who is being vaccinated. And so everything is not identical. You're not comparing, as it were, apples to apples. And I think the more important measure for us is looking at how well we are progressing with the vaccine numbers. But also, and I totally agree with the many of you that I've talked with, the ease of making an appointment. We recognize that's been a problem. We are working hard to ensure that we get that central vaccination mechanism in place to ease that up, even as the various districts have put in place an appointment system that worked fine for testing, but for the demand of this is so much greater than it ever was for testing that we found we have to look to another option, and we will get there in the next couple of weeks, if not sooner. I also wanted to, on the next slide, just remind everyone that we have 2 vaccines, and the other thing that to bear in mind is that Pfizer and Moderna are different only in that they require different handling. The Pfizer requires -90 freezers. The Moderna doesn't need to be as kept as cold. It still requires freezing, but not deep cold. And yet we were informed last night that 800 doses of Moderna arrived thawed out. And so you are aware that we are not doing the logistics of the transport. This is all done by CDC and or Pfizer directly. You know, we tell them where to send it, but we're not deploying state patrol to to move the vaccine or keep it cold. This is Pfizer and Moderna. And the Moderna is through the CDC, the vaccine program. And so in a sense, the logistics are actually done by the CDC program, but even they have been not able to abide by all the challenges. And we will get those 800 doses returned to us but later in the week. And so some of the places, it was Walgreens that was expecting it, or Walmart's, I'm sorry, was expecting that, will have to open their clinics later in the week than we had anticipated. But that's the kind of example of the challenges of logistics that are not in our control, aren't in GEMA's control, they are being handled on the federal side. Will this change as the new administration comes in and as they have made this a priority? I suspect that it will. And that's why we're really continuing as rapidly as we can within the limitations of the current allocations, but have to remain agile to be able to respond to whatever changes happen at the federal level. The other challenge, of course, is that both are 2-dose vaccines. We feel strongly that science supports 2 doses, not a single dose. You don't have evidence that there's adequate sustained long-term immunity after a single dose. And so we have to ensure that everyone we vaccinate with 1 dose gets their 2nd dose either 3 or 4 weeks apart with the same vaccine. Again, it's just very important. These vaccines were tested in a wide range of populations. but they were largely adults. The youngest involved in the trials were only 16, and then older adults into the 80s and higher. So at this time, we did not have a vaccine for children. They are intending to test these vaccines in children, but at this time, we are not trying, or we prioritize children as part of our population to be vaccinated. I also wanted to mention that, we have, by expanding our vaccine target population, we have expanded, opened up to about 2 million total people. And that not only includes all adults 65 and older, regardless of their underlying health conditions, but also law enforcement, firefighters, first responders, EMS, healthcare workers. These are all the individuals who are helping us fight the virus, even as we are trying to get the vaccine to prevent in as many individuals as possible very quickly, particularly the highest risk individuals, which are the older individuals. And once again, today I looked at our data. The highest number of outbreaks have been consistently in long-term care facilities still, even though we have been vaccinating there first. And although they represent about 5% of our cases, they probably represent about 43% of our deaths. And so to me, it was just absolutely critical that long-term care facilities, were one of our top priorities at this time. I very quickly want to just go over the dashboard. This is on the next slide. It's on our website. Oops, next slide. I'm sorry. Next slide. Yes, there we go. And this is constantly, this is updated once a day, but it's already out of date because we know that our vaccines administered as of 8 o'clock this morning were over 451,000. And our providers enrolled keep changing and growing. And we will continue to update this as well as on our website, where we have vaccine, and particularly as we add places like various pharmacies, both independent pharmacies and chain pharmacies, where people all over the state are accustomed to going. I think that will truly increase significantly access for individuals, as will the big campaigns. When you think about our state with almost 11 million people, at the rate we're going, it's going to take many, many, many months. We really need to do some of these big, being able to do these big vaccination sites. And we hope that will happen soon with the availability of new vaccine. I'll close up here before I move into the budget piece, just in the next slide. Next slide. Yeah, I really like this slide because some of you may be as old as me, and I remember a mass vaccination campaign, but it was polio, and it was in the 50s, and I remembered us all lining up to get our shots, and we didn't have the same kind of concerns, I think, about the vaccine at that time. It was really almost jubilation because we knew so many people who had polio. We experienced not being able to swim in the local lake during the summer because of concerns of polio, and luminaries like Elvis Presley at the time were our heroes by getting vaccinated on camera. I hope that when you all get vaccinated on camera too, that you'll share your experience with family and friends and your patients. And because I think that it's important for Georgians to see that you believe in this vaccine, that it's safe, it's effective, and that it's the one way we have to stop this virus in Georgia. It's just incredibly incredibly important. I also wanted to say that we will be rolling out into additional facilities and additional vaccine population as we get additional vaccine, as we move further along in that, in our effort. There's questions that keep popping up, but I'm getting distracted because I want to answer your questions, but I don't want to lose where I am in the, and the answer to Senator Walker is yes, we have used 50% of our vaccines. Some of that is sitting in Walgreens and CVS waiting to finish up the long-term care facilities. So they have, they get their allocation that counts against us and is there. But also many providers, including for our big mass vaccination campaigns, we don't want to set up appointments or start to finish planning until we have that vaccine in hand. And so most of those doses are actually already allocated. And there's a plan for them. It's either a big event or appointments, and some of our smaller health departments are booked out till March. And so it looks like we've only used half, but that other half isn't sitting somewhere. It's sitting because it's going to be used in the next days ahead. So I want to reassure you that optic of vaccines sitting in freezers is not what's happening right now. In fact, it's just an incredible push to get the vaccine very, very quickly. And once again, your leadership in getting vaccinated when your time comes will be, I think, so important that we can encourage many of our including our healthcare workers that didn't want to be vaccinated to now take the vaccine, even as they are continuing to be at risk by working in hospitals or long-term care facilities. I think about 6, maybe it was 7 months ago, I met with the Clayton delegation and I was asked point blank, would you get vaccinated now? And I answered honestly, I wouldn't get vaccinated now until I see the data. I want to make it very clear. I've looked at the data. I've actually gone on the FDA website. The data are just extraordinary. I mean, the fact that the federal government was able to develop, and the private sector, because Pfizer did this independently of the government, was able to develop a vaccine that is so effective, so quickly, and is safe, is actually a medical miracle. And so I wouldn't say that it's safe and effective if I didn't believe it, and I've gotten it myself, and I am absolutely relieved to be able to say that, because I think all of us are worried about that. Now, all of you and your constituents want to be vaccinated too, and so our top priority right now is to ensure that that happens. And you will see in some of your home health departments that we will have to reduce services at the local health departments because we can't do all of these things at once, which is again why it's so important that other providers are helping us, including having these large mass vaccine sites, which will be absolutely a very, very important part of our efforts throughout the state, not just in Metro, where we're planning some at Mercedes-Benz Stadium, and I hope also at Brave Stadium, but also in other parts of the state, so that there's more access for everyone very, very quickly in these large events. And that has been successful in other places, even as we continue to vaccinate out of local pharmacies and close areas wherever people live and work. That probably, I just want to leave before we move on. we have been able to bring on a lot of additional staff to help, and will continue to do so, as well as the volunteers through Serve Georgia. Please, if your constituents ask about how can they help, have them volunteer through Serve Georgia. They're helping us with a lot of the activities, including filling out some of the paperwork that's required. But we also are asking National Guard to help us with some of the logistics and some of the, and already they are helping with some of our sites, and also continuing to help us with our testing sites. And that's been an important partnership for us. But I think a real shout out to the private sector medical community, who has just been extraordinary to work with and continue to be part of our efforts. On the next slide, I know I may be running out of time, but I want to very quickly go through some of the engagement that we've had, because I think one of the, if you can say there's a silver lining to any of this, which is difficult to see, it's that public health has been able to partner with a lot of organizations, agencies, and the business community in a way we never did before. And it is really, I think, an important strengthening of our community efforts to have the business community sitting down with us, talking about how they can vaccinate their staff, how we're working with them to ensure that, you know, they have the capacity, and when vaccine is available, get the vaccine, that they can help us deliver the vaccine to their staff, whether, you know, it's here in Metro or throughout the state at other facilities. I mean, the business partnership has been, to me, one of the most exciting and important collaborations that we have done, because I believe it will allow us to continue to return safely to work by ensuring that there's vaccine available even in the work site. You know, we, as I mentioned before in other talks, we worked with the Department of Economic Development in a new and important way. And we've worked with the chambers in ways that we haven't before, and will continue to do so. Agriculture, probably one of our greatest, greatest industries here in the state, you know, it has been a critical partner for us. I have personally visited farms, and many of our staff have visited poultry plants. Many of our epidemiologists have gone out to help them plan on how to mitigate and and we've actually written guidance documents on safe operations, whether it's at farms or in poultry facilities. And we facilitated testing of workers, and when the time comes, we'll also facilitate vaccination of food inspectors and other agriculture inspectors. And so with that, you know, we will continue to support the Department of Agriculture and the whole farming and other industries related to agriculture, because I think that's been, again, a partnership that we hadn't developed before and will continue to be important in the months ahead. We've worked very, very
Dr. Toomey,
closely.
if you don't mind.
Yeah,
Dr. Toomey, this is Blake Tillery. If you don't mind, we're gonna, if you don't mind, kind of moving to the budget things for the last 3 or 4
Sure.
minutes, because we have a lot of questions that we'd like to ask, and we know
Sure,
members
sure,
will
sure.
as well.
Okay, so nearly everything I've said has been federally funded. And there's been some funding coming out of the Corona Relief Fund, and some of that is still pending. But most of what you've seen here, both for the testing, for the payment of the laboratory, as well as, next slide, by the way, as well as for the vaccine, is coming from federal dollars, as well as our public health response grant, which paid for quarantine facilities throughout the state, including at the, uh, including at the Georgia Public Safety Training Center as well as at the airport. And so with these, although this looks like an extraordinary amount of money, we pretty much went through our entire CARES 2, that's the ELC grant that we got to pay for our testing, because we had multiple labs that were with whom we were contracting. And we have additional dollars coming for the immunization program, but not nearly enough to be able to do the kind of mass vaccination efforts that we need. So we do know that. And we are anticipating, again, some additional federal dollars. But in the meantime, we're going to, hire, as somebody asked, is staff we need, get those volunteers that we need through Serve Georgia, and partner with other facilities. Let me just quickly move on to the next slide, because I think if you exclude these federal dollars that were exclusively directed towards the coronavirus response, public health is largely, there's very little personnel in our department. Much of the personnel is actually at the county level. So only about 13% of our total state budget is directed to actually staff. Most of our budget, 65% or more, is to direct services. The contractual services include things like HIV care and operating expenses. So the 690 million plus budget, state budget, is more than 65% direct services or contracts for direct services. And if you look by funding source in the next slide, and this again doesn't include the new federal dollars that were used for the federal corona response. The good news and bad news is that we get a considerable amount of federal funds. Almost 60% of our budget is federally funded, with almost 40% of our state general funds making up the remaining bulk of our budget. More than 50% of the state general funds go to grant and aid to counties. I think that's important, because that means that those funds are going to the local areas to continue the work of the health departments in the 159 counties. The other thing to bear in mind when you're looking at the federal funds is these federal funds often require some degree of state match. And that has made us look very carefully before we seek other federal funds, because just getting a federal fund because you can get additional funds may not be the best strategy, because we don't have the match on the state side. You can't double match with our state dollars. And so we've been very selective and careful about seeking additional funds to ensure that it's we're getting the funds to meet the needs of the state right now. It's very quickly, if you look at the actual budget recommendation, there's next slide, I'm sorry. So the Grady Regional Coordinating Center, which was developed after a crisis occurred in hospital capacity, was partially funded last year. The $289,000 in the supplemental will allow it to be fully funded, and that will continue into 2022. Interestingly, this coordinating center, which we are working closely with Grady on, coordinates EMS access to various hospitals. It actually has been very, very useful during this COVID response. Moving down into the infant and child health treatment services, there's some savings that we're seeing during from the EF map, so the Medicaid match. And for 2022, there'll be an FMAP adjustment. So a savings in the supplemental, but a reimbursement for 2022. For the infectious disease control, there's in the supplemental and carried over into 2022, there's an additional $144,026. These were positions in the HIV, STD, TB program that were inadvertently reduced at a time when we were reducing some positions to make our requisite reductions. And this was not intended to be cut, so they're put back to continue in those programs, which are very critically important programs. And for the pre-exposure, the PrEP pilot program, we will be asking for 85,000, or I think will be allocated because it's part of the legislation, $85,650 to continue the pilot study where we are working both with Fulton in the metro area where they have a PrEP clinic, as well as with the Gainesville district where we are in the process of establishing a PrEP clinic in Towns County. And then we'll be looking at the impact of having that PrEP clinic and the reduction of HIV transmission. Towns was chosen because it was felt to be high risk, both from, STD, HIV prevalence, but also opioid use and other factors that may contribute to high rates of HIV transmission. On the body art licensure for FY22, there's an additional $173,600, and that's to establish the body art licensure program, which was actually passed in the 2019 session. We had never put it in place because we didn't have the funding and the staff to actually do that work. There will be fees charged for the licensure, which will go back into the general funds. And essentially this will be largely budget neutral because the funding that will come back to us will be paid back in fees and probably will just be a fraction of the total fees collected. And then the teachers' retirement system adjustment, as you've seen in many of the other departments. And so that's all I have. It's a lot of information. I gave you a lot of background on COVID, and I'd be happy to answer questions. And if we don't have time today, I'll be happy to do, as I did the other day, a special briefing because I know there's a lot of questions. I know you're getting a lot of phone calls from your constituents, as am I, and we really view the work in COVID now, and particularly expanding access to the vaccine, and our highest priority and probably the most important priority public health has ever had in the history of public health in Georgia. My last words are to say that we literally don't know week to week what our allocation will be. And there's been some a disconnect between what we were told was coming and what actually is available. I think this week we are going to be closely monitoring the changes after Wednesday. There's been a promised addition of vaccines, but we can't make those moves of adding additional providers until we know exactly how much vaccine is coming. And so we'll continue to monitor that closely. And with that, let me just turn it over for questions because I know many of you have them.
Thank you, Dr. Toomey. We do have several questions. I'm going to try to sum up a few of those really quickly. We know we won't have time for all of them, and so your offer to brief us, especially later on, will, I imagine, be taken. So we'll look forward to contacting you and get in touch about that. First thing is, I just want to sum up this correctly. I think in 2020, the first CARES portion, the Department of Public Health received, by your slides, about $1 billion.
No,
roughly.
the
And it-
CARES one, we got about $30,000. I didn't have CARES one in there. We got about $36 million. And
The corona relief.
right, that was CARES one. And then there was CARES two, which was our epidemiology and lab capacity program, which came directly to us. So of the funding that came to OPB directly, we got some money, but most of the funding that we used for our response came from the CDC direct funds through what we are calling the Epi and Lab capacity grants.
And that is separate from the roughly 700 million we're expecting to come in the next month or so from the bill just passed by Congress, correct?
Yes.
No, it's
No,
included.
no, it's
Oh, it is included.
We got it in this number.
Okay,
yes, in this
okay,
number.
good, okay.
That included in that
Yeah,
figure.
it is included.
The next question, we're going to go to Senator, I think the one who's been waiting the longest is Senator Davenport, number 79.
Thank you. Thank you very much, Mr. Chairman. Dr. Toomey, thank you for all you all do. We have been telling our constituents that it's safe to take the vaccine. I've talked to healthcare professionals, doctors, and even a former United States Surgeon General that lives in my area, that it is safe, trust the science. But now people are trying to get on a line to make an appointment to get it. And it is very frustrating. I just need to know what I need to say to those persons. I talked to someone in the health department last Friday, and they told me to tell my people to be patient. But people who are 80, 90, and 100 years old that live in my area cannot get the vaccine. And I know you're saying that you will have mass vaccine sites soon. Will that be next week or the following week, or will it be the middle of February? Because it's been stated that the middle of February, 500,000 people will be dead, 500,000 people. So these people in my area are not in long care facilities. They're at home and they can't get the vaccine after we tell them to do it. Of course, Congressman Scott on his Zoom the other night said if you could not get the vaccine, call him, he would help. But they're looking to us to try to do that. So can you kind of address that? Are we waiting on this 700 million or whatever now in order to get these large sites going?
We're actually waiting for more vaccine to get the large sites going. And we, as I said, we recognize that the 18 different ways of making having 18 different call centers was not optimal, and it's in the next several weeks. We're hoping to have that centralized appointment system, which will help a lot. But also that the Krogers and the Publix and the Walmarts are really going to help improve access. The other thing I know has been on people's minds, I've been contacted multiple times, there's frail elderly that live at home. And it would be next to impossible for them to be able to travel to a vaccine site, let alone stand in line at a mass campaign site. And we're working on plans of how we can collaborate potentially with home healthcare facilities and give them the vaccine to vaccinate these homebound elderly who are as you point out, are critically at risk. And so these are all the things that are coming up. No, I think these mass campaigns are not going to be mid-February. We hope they'll be in the coming weeks as soon as we get vaccine. The hang up now is the allocation, and the allocation is so slow. And we've been getting about 80,000 doses a week, and that's not very much for a state with 11 million people.
Thank you, Dr. Toomey. Representative Parrish, Chairman Parrish.
Thank you, Mr. Chairman. Dr. Toomey, first of all, I want to say thank you to you and your team for the long hours that y'all put in over these past months dealing with this virus. But there's a couple of things that you touched on, and I wish you would discuss just a bit more. I think it would help. One of the things that I've heard is that the allocation of the vaccine that we receive really is not adequate to do the job that we'd like to do. But one of the concerns that I have, it seems to be that the bottleneck is actually getting the vaccine in the arms. And there has been some confusion as to who could actually administer the vaccine. Could you elaborate on that just a bit, please?
Yes, no, thank you. And that's, I think that's a really important question, because the more people that we have available to help us vaccinate, the more people can be vaccinated. And as we get additional vaccine and have these large facility vaccinations available, you know, we have looked at not just our own staff, nurses, physicians, other traditional providers. You know, we've looked through the executive order and other, and looking at existing legislation, expanding that list. That list also includes dentists. Dentists couldn't vaccinate, and which didn't make sense to me, because they certainly put needles in your mouth, and it made sense that they wanted to volunteer and help us. Now through the executive order, they now can vaccinate as well, as can student nurses, student pharmacists under supervision, as can student doctors. And as I mentioned, student doctors have staffed a lot of our vaccination sites. But the other thing that's been brought to my attention by several individuals, medical assistants in many areas are the ones routinely doing vaccinations in physician offices, and LPNs are the ones routinely doing. So licensed practical nurses are the ones routinely doing vaccinations, not only in our clinics, but also in physicians' offices, and also many are school nurses. And because of some quirk in our executive orders or the legal, the current orders, they were not allowed to practice without direct supervision. And I spent a great deal of time over the phone this weekend talking about that, because I feel strongly a well-trained LPN, a well-trained medical assistant who understands, they give a vaccine better than I can. And they do it all the time. The real complication with this vaccine is the potential side effects that happen. That's why you have to wait 15 minutes and make sure there's no reaction. They can be well trained to be able to respond to those reactions and appropriately address them safely and with their supervision offsite, and be closely monitored without someone in that facility who could be elsewhere vaccinating as well. And I really see, I've requested to the governor's office that they add these individuals in the next executive order. And in doing so, we'll actually free up the opportunity for many additional providers, particularly in rural Georgia and the schools.
Thank you, Dr. Toomey. We got one more question. It's going to come from Chairman Watson. We also are going to be writing down all the questions that came in through chat and getting to you, if you don't mind addressing them with the individual representative. Last question from Chairman Watson.
Thank you, Mr. Chairman. Dr. Toomey, just thank you for the amazing job you've done. And real quick, as you continue to have these challenges and frustrations and things that are going on, how is your employee morale? And have any of your frontline workers received any supplements or raises as we've gone through this process? And I know it's going to become even more challenging. And how are things on the ground?
Yeah, I mean, I think this is probably the most challenging thing all of us have ever done. I think, I'm speaking for myself and the health directors. I think all of us are tired and fatigued. Some have gotten supplements, because they've taken on additional work. I can't speak for all of them, particularly the county health departments, because we don't have those individuals in our system. I think morale, I think there's some frustration that so many people through social media will criticize, and we so seldom get thanked for the work we're doing 24/7. And I would ask that when you are back in your homes, thank your health department for the work that they have done. I actually videotaped a thank you to everybody throughout the state for what they've been doing. And I think that this lift was never anticipated a year ago when I talked to you. I don't think anybody envisioned what this was going to be like. And I think morale is important, but money is important. And I think that's something that I can address with the health directors this afternoon when I talk to them. But even more than money, a thank you and an appreciation for what they've been through, and not the negativity that seems to come. Social media has made response in a pandemic extremely difficult for all of us. And I really urge you, if you can, when you're home, or if you're home now, please tell them thank you for what they're doing, as I am doing.
Thank you, Dr. Toomey. And on behalf of our colleagues, let us all thank you for the work you're doing and our frontline workers to help Georgians become vaccinated and be safe in this time that is unparalleled, as you've already stated. One quick question. When you put up your slide a while ago of the number of vaccines that Georgia had, I think it was roughly 900,000. And then we had put in arms about 340,000. Does that 900,000 count dose 1 and dose 2? In other words, are we having to hold 450,000 of those back for dose 2, or are those all dose 1s?
Well, 451,000 is the actual number of this morning. And most of those are dose 1. We've only begun to do dose 2. And on our dashboard, we will begin to break out dose 1, dose 2. And I would just say that our own dashboard on our website will be the most accurate number. I don't know what's happening in the transmission of data to CDC, and I don't know where these national news media get their numbers, because they're completely off. And I don't know, I haven't had a chance yet to ask some of my colleagues, because I talk to other state commissioners several times a week. I don't know how their numbers are, but I would say check our numbers, and that we will be breaking out first dose, second dose, but we're just beginning to do second doses now. So most of those are first dose.
So none of that 900,000 is being held for a second dose then? That is all available.
No, we were told the second doses were being held at the federal level. They aren't, and so we're just ordering second doses de novo, and we're in the process of doing that now. Whether private providers are holding it for second dose, I can't be certain, but we've told them not to, and ask them, please, if you are doing that, to release those doses so we can use them for first doses.
Thank you for that clarity. Thank you again for your presentation this morning. We will get the questions that were asked online that we didn't have time to get to you personally. And thank you again for your addressing those with individual members. We appreciate your time.
Thank you for your time and attention, and most of all, your support.
Yes, ma'am. Next, before the committee, we'll have Commissioner Gary Black. I believe he's outside and waiting admission into the committee room. Commissioner Black, thank you for joining us this morning. I
Yes,
think
sir.
most of us know you already, and the floor is yours.
Thank you, Mr. Chairman, members of the committee, and good to see y'all. I hope y'all don't mind. I just come across the street because we're we're close, so we can be with each other. Thank y'all for the privilege of being with you this morning. And we've got, I hope, a good report for you this morning. Look forward to your questions, certainly, as we move forward. We're on our tracking sheet, I believe, is page 13 and 14. And the small budget is 13. I'd like to mention a couple of things about that before we, as we get started, just in the small budget. We've got some additions there that we are grateful for, and thank the governor for recognizing some things that need to be balanced out since our last time together. $500,000 for vehicles, and it's certainly one of the big challenges we've had during this whole time is making sure we can get Georgia National Fairgrounds and Agri Center back operating and keep it. Of course, they've been operating and doing a fantastic job, but we've come up a little short on our funds, and we're grateful for those. And that's in the small budget. I'm going to talk more of the rest of this time on some of the big issues, and I do have some asks for you. I have some asks that are going to be based on the work that we do and the fees that we generate. But then I also have got to start off with just of course, everything's a general appropriations, but there's sometimes when we're dealing with the needs of employees, it really does come to just adding some money to make sure we're taking care of employees properly. And that's where I'd like to start today. Every time when I get off at the exit here coming from Commerce and coming to work, and y'all, if you got off coming southbound today, you saw it. You saw it right there in front of Grady. It says Heroes Work Here. And they absolutely do. It's been an amazing year. I think we can all agree with that, but it's pretty heartwarming to go home to a neighborhood and see one of those signs up in somebody's yard. And that's absolutely in the healthcare business. It's straight up, and all the other folks in law enforcement. But what I'd like to compel you to understand, and I hope you'll agree with me, is I'm blessed to be able to work with heroes too. There were heroes that kept the food on our table. There are heroes that produced it under very unusual circumstances. I know Chairman Watson would attest to that, and others. But there are folks that I get to go to work with every day who help make sure that food's safe, that are inspecting the meat, that are making sure our livestock barns are open, making sure that peanuts are being properly tested in our laboratories, to make sure that business openings are able to, the continuity of business, we're able to respect that throughout this entire challenge and keep gas stations open and new food stores opening. All that is taking place during this particular time. Structural pests, folks that are coming in that treating and taking care of our homes. That's the roster of 500 plus folks that I get to go to work with every day. And they each deserve one of these signs in their yard for the work that they've done this past year. I'm honored to be able to lead them, but I come before you today with a request for these heroes. These heroes have gone to work every day. They didn't stop. There was no hesitation. And I know there are a lot of people in this government that did the same thing. But I can tell you right now, the next morning after we started working under the first executive order, our folks put a mask on and went to work, all of them. And they deserve our praise, and my high thanks to all of them. And I, by the way, we've told them many times, and we'll continue to tell them. I ask that you help me tell them. We do need to address some salary deficiencies. I've got a $780,000 ask. It's just a straight up ask to help us with starting salaries and to help us with middle management. That is a need. Love to work with the subcommittees, and certainly both chairmen, as we can get into the details of that a little later, but that's first and foremost. Our employees are always going to be first on my list. The to get into reports from last year, and it was very interesting. It was a very interesting time. They all came back in May, you know, and there with about a couple of weeks, we had, you know, the necessary things to try to keep this government open and keep, you know, y'all get a final budget through. And, you know, the 14% shock was pretty tough on everybody, but we did go to work, and but I will tell you, y'all were very kind to us. I think we made a good pitch, and you worked with us. We were not at 14%. We wound up with cuts at 6.8%, and I'm grateful to you for that. But I want to address one of the primary things that probably caused as many emails as anything else that we did, in trying to find those dollars to make those cuts, and that's around our farmers markets. But I've got good news for you. There's some very good information that our team's worked very hard. We've worked with the communities, each of the communities. We worked with some other state agencies, and I think we've got a very positive report for you with respect to the state markets. First of all, I would like to point out Thomasville, and I hope that Representative Taylor, Representative LaHood, perhaps, I know Representative Watson, Chairman Watson, I know Senator Burke, we had conversations all about this, and I will tell you right now, in the flurry of 2 weeks of trying to prepare for that, and that's not excuse, it's just the reality. I'm gonna tell you, I was wrong about Thomasville. I made a mistake about Thomasville, and I ask you to forgive me about Thomasville. We had some one-time expenses that kind of were messing up the early parts of the figures for 2020. Those are what we were looking at, and when we got to the end of 2020, we were wrong. And so, but furthermore, we've done some good things in Thomasville to keep us new community advisory committee. The communities come around that market like never before. So I think there's some positive things going to happen. But the same has happened in Cordele. The same has happened in Savannah. Senator Lucas, we've made some progress in Macon. I'm really excited about that, and in Augusta. And so all of these that we actually had on a list, we've been able to rescue. Some of it was just new information since the last time we were together. And so I'm excited about some possibilities in Savannah. We're working with some developers, working with the community to see if they may be, Senator Watson, we've talked about that. We'll see what happens, but it's in a positive place right now. Macon, we've got some new cooperation with GEMA on some of our facilities that are helping take care of some of the expenses that we needed and get that down. And plus, we've allocated some of our expenses across some of our departments because we have a training facility there, and that's going to make that look a lot better. Cordele is where we've made the most progress. And I want to thank Representative Williams and his team down there that have come together to help us with some local expenses, get the communities more involved there. And we just, it's a very positive outlook even now for Cordele. Let me wrap up with an exclamation point. Mr. Chairman, we've not talked about this, but Augusta's just always, it's kind of been on the edge, and we've kind of been in the real estate business there, but we're fortunate to do an economic development project right after it really got some information right after the session ended last year. We have done a 5-year lease with FPL Foods, who will use and building out part of that facility for meat processing, for value-added breakdown of products. And that actually a good bit of that's going to be Georgia-grown beef. That's going to put Augusta in a $100,000 plus environment for the first time. I mean, it's just something pretty much to be excited about. So that's the request on, that's just a report on our markets. Mr. Chairman, we do not have any bonds, as you know. We would love to visit that if we have a possibility, because we could do two things. We have to have operating money. We have to have maintenance money. We've been borrowing money for a long, long time. If we want to get into the cash business of helping us operate that way and actually operate off of our fees, then that would be great too. But I hope we'll be able to have some conversation about that as we move forward. Hemp is another popular program, and I think I told you all last year I have 2 phones. One for there was a period of time there where I had my department phone and I had a hemp phone. That's about how often it was ringing. But it was very interesting to see this program develop. Got some good reports for you in the materials about how many licenses we have. We've had, at 2020 revenue was $337,000, but as we wrapped up the session last year, y'all allocated $200,000 to us. And so we're 137 on the plus side, but we're not able to meet anywhere close to what that infrastructure needs to be to grow this industry. We've laid that out for you here. There's a request for $453,000 and a number of positions. And you say, wow, that's a lot, but do we want to grow this business or not? My director of licensing is, she has almost, I will tell you, 20% of her day is spent on hemp. We've got to allocate the resources to make sure that these programs are able to grow, and we have just an ask there for you. That winds up being about $200,000 greater than the fees, but I hope I've got a suggestion to you of how we can actually grow this in the future. Let me move forward to the GATE program, something that's near and dear to every producer in the state of Georgia, and some really good foresight of this body, both bodies, to say, how do we get this program? How do we preserve it for the future? We did raise fees a couple of years ago. Currently, last year we wound up with $678,000 of administrative funds that were back to us. We did cut our compliance officers, some other things that in that mandatory cut. But I want to call your attention that we expect that our revenue this year is going to be $1,350,000. I think you can, a lot of us talked about what's going to happen with this program long term, because, we had an influx of people to start with, but gradually it's trimming itself out. It's kind of like a boat, kind of like on a set of water skis where you're trying to get up, but now we're planed out pretty good. We're seeing those numbers come down and balance out over time. A little over 30,000 producers have one of these cards now, and I think that's a natural trimming of the program. But what's our ask here? Our ask is we still have statutory responsibility for education. That's in the code, says some things that we're supposed to do. We've got to do that front line of education for retailers and those folks in order to ensure the integrity of the system. Members of the committee, we have a $530,000 ask of gate fees, which still comes in at $141,000 less than what we're collecting. That I'd like to ask you to help us do two things. We'd love to do our education through the market bulletin and make sure that every gate card holder gets our every 2 weeks market bulletin. If we could do that, that's one of the most cost-effective ways to actually educate people, rather than just kind of riding around doing meetings. I think that's something to consider. And then also we have 200,000 out of that 530 is 200 of that is for building our infrastructure just within IT. This will help us with just some modernization. And there's some things we need to do with licenses. This actually helps us with hemp, helps us with some of our newer licensing programs, and we look forward to talking to those details to you as we move forward. One other new program, and this will be the last from a respect of an ask. This piece of legislation was, I believe, the House bill was 1057. Both bodies considered it over the last 2 years. I know Senator Anderson. We've had numerous conversations about soil amendments, and we had some problems in this area because there was really not a very stringent regulatory program around this. Law dated back to 1976, and there were no fees associated. But since then, we have lots of different things that can be called soil amendments, and they're produced by lots of different people, and they're safe. They have capacity to build soil health in Georgia, and they have to have a place to go because they don't need to be going into the solid waste facilities. But Representative Rhodes passed a bill. We've got a new soil amendment program now. We're anticipating fees this year to be about $255,000. And one of the discussions we had last year that we would come back and report to you in January what the value of this program is going to be, what our need for a soil scientist and a couple of folks that would help us so we can ensure the integrity of this program that we've created by law. Mr. Chairman, members, we've also included just for informational purposes, a copy of our teleworking policies. We had some questions about this from both the House and Senate offices, and anybody has any particular questions about that, I'll try to answer you. But I will tell you, it's been a fascinating thing of just how productive we've been. You know, we all wondered about that, but when we have 280 people on a Zoom training for structural pest control, or whether we're just doing our internal meetings as we've certainly have that level of communication. I'm not so sure. It's kind of one of the paradoxes of the whole situation is that particularly back in the spring and early summer, I think our communication was actually at an all-time high internally, because there was a forced situation that everyone actually benefited from. But we're still operating certainly under guidelines, but did want you to see that. So members of the committee, Mr. Chairman, and others, our summary of requests is $780,000 for inspector salaries. That's for starting salaries and for middle management. We'd love to, we believe we've made great progress on our farmers markets, and just sorry that we had to go through some of the things we did last year, but sometimes that teaches us, and I'll be the first to say we've learned a lot. We have a pretty strong request for hemp funding, but do we want to build this industry or not? That's what that request is about. We have the fees to help pay the way. Likewise, with gate revenue, we're asking that you give us what we're collecting, and we'll put it to use with respect to education for gate, but also improving some of our IT infrastructure. And then the soil amendment revenue, I said we're going to collect $255,000. We have a $240,000 ask that's backed up by those fees. There's one final bit of information. I know Senator Burke and others, we've talked a lot. Hard to believe that we're still kind of pick up a conversation about Hurricane Michael, but we do. 2 years ago, you were very bold. We had Safety 21 loan program that I wanted to give you just a quick stewardship report. The health of this portfolio, even with the challenges within agriculture, is incredible. Out of the 479, there were 479 requests. We closed 276 loans. As of now, the health of that portfolio is only have 7 in delinquency. And we all knew that it was a gamble going into it. But I think any bank would like to have that health within their portfolio. And also on the farm recovery block grant, this is not state money, but we've finally completed. We will return unused resources to the federal government January 31st. The farm recovery block grant program, which we built by scratch, and that the federal government's actually already taken some of the things that we've done and used it for future USDA programs. Confirmed that last week. We have distributed $170 million to Georgia farm families that were affected, a little over almost 1,800 people. And that was a heroic effort by a very smart group of folks that we were able to put together at the department, but certainly with the Secretary Perdue and his guidance along the way. But did want to close with that bit, Mr. Chairman. But those projects are still ongoing. Thank y'all for y'all's vision and helping with that. But we're going to move on to other things, thankfully, that the block grant program is complete. So that, Mr. Chairman, that completes my presentation, and I'd love to answer any questions you might have.
Thank you, Commissioner. I don't see any questions from members in the audience. Chairman England, do we have any questions online?
Yes, sir. I just done something. I'm not a computer whiz. Hold on, I got it. all of a sudden the block disappeared and then it popped back up somewhere else. All right, so Commissioner got one question from our chat box here online. Thanking you and your team for your tireless work. But the question is there currently a system in place to test hemp and cannabis for various insecticides and mold?
Okay. Mr. Chairman, can I walk over there and hear? I didn't quite hear all the way.
Yeah, you want me to repeat it louder?
Sorry. Thank you.
The question for those of you in the audience was, is there a current process for testing for mold in hemp and
Yes.
cannabis?
Yes. Actually, that process is not done at state laboratories, but it is done by an approved contractor. And so, the one thing that's tested there from what the law requires is THC. And so I think all the law is that's done with the Georgia Crop Improvement Association as a third-party contractor. And so, and then third-party laboratories are doing the work. So it's not being conducted by us, but it's being done by third parties.
Thank you.
We could do ancillary testing if there was something else required for a quality assurance or something like that. But we didn't contemplate all that, and there's actually not enough money in the budget to run the laboratories. We thought it was cheaper to actually farm it out.
Thank you, Commissioner. Any other questions from members in the audience? We see none. Thank you for your time today. Thank you for being here.
Appreciate it.
We may have a second question. We'll grab that back offline later on. Members, right now we've scheduled for a lunch break here. We will gather back at 1 p.m. and come back live at that point in time. Thank you again for your attendance and presence here today, both in person and virtually. See that we did keep a little bit of our crowd. Thank you, senators and representatives, for joining us. It's 1 p.m. and at this time we have our State Department of Education Superintendent Richard Woods, who will be joining us. Superintendent Woods, are you already on board?
I am here.
All righty, the floor is yours.
Okay, if we can just go ahead and load up. We can just go ahead and get the presentation started. All right, again, thank you, everyone. I think we're loaded up, so we'll go ahead and get started today. But appreciate the opportunity to speak with you today. Look forward to giving you a few updates on our agency's response to COVID-19 and our plans for moving forward. And then after I give my remarks, but this will be followed by our Chief Financial Officer, Russ Grome. We'll give an update on the agency's budget. And after that, we'll be available for answers. Also joining us today will be Matt Cardoza, one of our policy leads if need be. So we'll go ahead and move to the next slide, please. And I want to thank each of you for investing in Georgia's students. I think first and foremost, you have had a wonderful commitment to Georgia's children and the investments you made in public education over the last several years. We've been through some tough decisions, or when tough decisions were required as a result of declining revenues. You prioritized QBE funding. You provided additional funding to expand the APEX program and support student mental health, and you provided a much needed raise for teachers. So on behalf of myself and all the educators and support staff throughout the state and our districts, I do want to say thank you to each member of the General Assembly for your ongoing support, and that of the Lieutenant Governor and the Governor himself as well. Okay, next slide, please. And as you know, COVID-19 has had an immediate impact on education. I think it was kind of hard to imagine last March that all of a sudden, we got word that we were closing down. I think initially I thought this would be maybe a 2 or 3 week endeavor, but unfortunately, as we found out and as the virus began to hit hard, It gave us a different look. We were able to close down schools successfully. I think one of the big things that we looked at last year was that most of the direct learning we had covered. I think we were getting ready to get into our testing system or season. And so I think as far as content, we were in good shape. What we have looked at is that, it did become a challenge as we, began to look at virtual. I think we found some things out throughout the state of, where we were. We worked to improve some of that learning. Again, many of our districts, provided learning packets. Also, we were involved in trying to figure out how to, feed a lot of our students, who were desperately in need with that and meet our obligations. I do appreciate, Agricultural Secretary Sonny Perdue and providing Georgia with a lot of waivers in that area, which made that possible. But once we, got into that, we immediately began to look at what school would look like for perhaps a year-long process in which we would have to deal with the virus itself. What you're seeing on the screen, is kind of a map of before the holiday break and, where we are currently. And I think that as I looked at one of the things that I've had the pleasure of doing is that I have visited probably 49, plus schools since, since August. Our districts have been doing a great job at really focusing on keeping our students and faculty safe, addressing, the need for safety as we've, looked at that. And that's whether, driving our kids, on buses, feeding them, looking at also, teaching, instructional models, and whether that's virtual or not. Also my hats go off to Dr. Robin Hines with Georgia High School Association. We, recently completed our football season in good order. But prior to that, we had girls softball, girls volleyball, and boys and girls, cross country. So, school has been taking place since August. We had, initial rollouts and things did look a little bit different throughout the state. You can clearly see as we look at that, a snapshot of the instructional models being offered in the different areas. Again, looking at the both maps, the blue represents a district offering 5 days a week in person, with instruction, typically with an option for virtual instruction if the family chooses. So again, most of the state, when you look at our before holiday break, we were face-to-face when you look at district-wide. I visited, a good many of these districts. Instructional models did vary as we looked at moving forward. We look at, the districts in green, they, offered a hybrid, which is an A day, a B day, in which, on the A days, part of the students came in, and B day, the other half of the students came in. And then, of course, we have kind of the, peach color, and that represents districts that have been, were fully virtual from day one. And so I think, one of the things that I appreciate with, Governor Kemp giving us the choice throughout the state to make that decision at a local level. Probably on average, as I've traveled throughout the state, we were probably about 70%, face-to-face instruction, throughout the state. Again, looking at some districts, they were around 90%, or if not over 90% in face-to-face instruction. And of course, we do have, some of the districts that have been virtual. Looking at where we are currently with the map, we're, seeing some things that we're looking at, as we try to roll back. We did have some spikes with the COVID-19 after the Christmas and Thanksgiving break. So we are having to adjust with that. Our districts, again, this is, some work in which we did work with DPH, and a lot of this reaction is to the guidelines that we currently work under. But, that being the case, you'll see that a lot of districts are beginning to the process of rolling back in. In fact, many of the districts, their target date was probably today to start rolling back on our current models. This data, again, is reported to us locally by the school districts, and the landscape does change quickly. So there may be some minor discrepancies, depending on what, was going on at the local district. There have been some changes, but, as I shared, by and large, we're having school. We've been successful with that. We are adjusting as needed. It has been a challenge, but, definitely my applause goes out to all of our districts, and especially down to our local, schools with our teachers and the things that are going on there. Okay, next slide, please. As we look at really our message throughout the year has been really compassion over compliance, and we're trying to meet the changes of the pandemic. Really, this was a huge undertaking, something that I think that as we look at has been a daunting experience for all of us across the state, and no less for education. But we have had a lot of great partners working with us to make this take place, to make it where, schools are going on and education's going on. First, getting room meant we had to ensure school districts had the tools to do it safely. That's first and foremost primary obligation was to make sure that our students and staff could go in a situation in which they felt safe. There was definitely a lot of apprehension as we began the school year, a lot of unknowns as we addressed this school year, and additional planning. I think some of the districts did delay opening schools just so they could have additional preparation, and so I applaud that work itself. But we have been working and did work with disinfected and raised to every district in the state. We also worked with the Georgia Department of Public Health to issue general restart guidance, and with school and district staff and other stakeholders to issue specific guidance on connectivity, distance learning, mental health, school meals, and facilities. So this was a very comprehensive plan. I want to thank Dr. Toomey and her staff and the governor's staff and other agencies, GEMA, for just working together as a complete team, to put this guidance in place and, to make this, a palatable situation in which we could go into the school year feeling that we were, had a great plan in place and that we could do this very successfully. Okay, next slide, please. Without a question, one of the largest challenges that we continue to face is addressing learning loss as a result of the pandemic. Again, mentioned we did shut down the face-to-face learning in March, and so we had some extended, learning that we had to look at. We had delayed starts. A lot of our schools actually started school after Labor Day as we began to move forward. We looked at some of the things with the virtual instruction, and trying to look at what needed to be taught as we continue to move forward and making sure that we prioritize the instruction to ensure, school districts had the tools they needed a diagnostic tool to address learning loss, and we did provide that. We provided a formative assessment called Beacon. This is aligned with our Georgia milestones, and this was at no cost to the school district in the state. So each school district now has the ability to monitor and assess our kids in grades 3 through 8 in English language arts, reading, and math. And this is aligned with our milestones. So this gives them the opportunity to really take the time to find out where their kids are currently. This can also be applied to students that are learning virtual as well. So we continue to look at that and prepare our kids for learning. I want to assure you that one of the things that as I have traveled throughout, our districts are assessing their students. A lot of them are using Beacon, but it may be other assessment tools that they have used in the past to make sure their students are learning and progressing where they need to be. So, that is something I do want to reassure everyone that is taking place. We have also trained 15,000 teachers on virtual learning. We doubled the capacity of Georgia Virtual School and partnered with Georgia Public Broadcasting to create learning resources that are available online through public television. So this has been, really a team effort throughout the state using, public and private partnerships to make this happen. Definitely the learning loss, continues to be something we are, going to look at, and I'll address a little bit more of that as we move forward. So next slide, please. As we look at learning loss, we're also working to create a grant opportunity for school districts specific to addressing learning loss, allowing them to extend the school year or school day or provide summer programs. I think this is going to be necessary when we look at where our kids are. As I shared, we have learning implementation and platforms. They vary throughout the state. And one of the things we are looking at, and as I instructed my staff, even probably as early as October, that we have to start preparing for the summer, what that is going to look like. How can we support our districts in whatever platform they have chosen to make sure that we do our due diligence in keeping our kids up to date where they need to be. So I think this will be a continuing ongoing process, but we are very excited. We are using all our resources throughout, the department to lean in and support our school district. Dr. Stephanie Johnson in school improvement is doing a great job. Dr. Caitlin Dooley as well in school, in our teaching and learning. So we're trying to provide as much resource and support to make sure that our kids do not lag behind where they need, but if we are needing to extend learning opportunities, that we need to move forward. I think that's one thing we will definitely focus on and continue to make a priority as we move into the summer months or get closer to the summer months. Finally, our school improvement team, as mentioned, is providing direct coaching to the lowest performing schools to help them address learning loss. That has included modifying school calendars and daily schedules to address learning loss with increased class time. It could be tutorials, intervention blocks, and summer programs. So we're committed to make sure that no child, falls behind within our state, that we continue the great progress that we are seeing, and have seen over the past 6 years as we continue to move forward. Okay, next slide, please. One of the big issues I continue to hear, and as I've talked with superintendents and those at the local level, is the issue of connectivity. Looking at, how can we make sure that those that are choosing a virtual option, that they have the tools to ensure that their children, can stay engaged, that our teachers and have, the resources they need to make sure they can conduct classes with their students on learning. I've seen various learning models. In some cases, you've had nothing but virtual teaching. I've been, I think down in Tift County where you're live, and this was with students, in person and also at home at the same time. But you'll see that, a lot of great things have gone on with that. At the start of the pandemic, we did have an estimated 80,000 student households across the state that did not have access to wireline internet service. To close this gap, we did partner with the governor's office and private funders to deploy school bus Wi-Fi rangers to districts. And again, providing, hopefully trying to provide internet access to our local homes, and especially in maybe housing projects, which have probably been more effective with that as we move throughout the state. We use federal CARES funding to ensure all schools have broadband signal extenders from their buildings, using federal funds to issue 21 million in digital learning grants to schools, and form partnerships with major carriers to allow districts to purchase discounted mobile internet plans. And that's one of the things that actually was, kudos for working with our private carriers. I want to thank Chris Shealy and Dr. Osborne here at the DOE for the work that they did. So we continue to look at that. I know the governor's office is looking, I think, in their budget to provide internet connectivity throughout the state and improve that. That's something I think we are finding out that it is something that we desperately need, I think, for an educational standpoint, and also even workforce development as we continue to move forward. But that has been probably the biggest concern, as I shared, as I've talked with superintendents, throughout, is the virtual aspect of learning, what that has looked like, some of the challenges that still are out there, maintaining that connectivity and providing, resources. But we are going to continue to look at that, improve that, and I think in the days ahead, as we move forward, we will make improvements. The Georgia Virtual School is an outstanding model that we have, and I think trying to look at how can we expand that to our local school districts as well, and provide seat time for our students will be a much needed addressment as well. Okay, next slide, please. Again, one of the things I think we've all been concerned, we talk about the whole child, and definitely the challenges of the COVID-19 experience goes beyond, just the academics. And we've also worked to address, I think, the mental and physical health of our issues, as the pandemic has continued. Here, school districts have served and delivered over 111 million meals. I think, as I shared, this has been a daunting, mission that even during the summer, we continue to work with our local school districts, and also working with the U.S. Ag and Secretary Perdue, Dr. Lynette Dobson here in nutrition, to make sure our kids and families have been fed. That mission has continued. Right now, we're able to still feed all of our students throughout the state. What you'll find is that I think that our schools, we probably become the largest food delivery service in our state. Many of our schools, and working to address some of the concerns surrounding the viruses that the students eat in their classes. There are rotations during lunch. I think with some of the social distancing and the reduced student attendance has helped that. Many of our schools continue with some type of delivery or pickup service for those that are receiving online instruction as well. So, we and that across the state. But also, we've also issued guidance on staff and wellness issues. We've worked to decrease the focus on assessments, accountability, mandates can focus students' health first and foremost. We continue to make sure that is a commitment for us. Our districts have been doing a lot. We've been working with our guidance, counselors, our school nurses, and people on programs to make sure that we are trying to alleviate just some of the byproducts of the COVID-19 virus. So again, we know that by and large that we need to have our kids, face to face, but some of this isolation, some apprehension definitely has played a part in some of the things we look at. But also, it's not just for our students, but also for our staff as well. Many of our staff are, a little bit older, I guess, and so some of them have health concerns. And so we are trying to make sure that does play a part in what we are dealing with and how we are addressing that across the state. As we look to the future, next slide, please. Again, one of the things we look at even during the pandemic, I've been committed to make sure that we continue to improve and provide our children with an exceptional experience that prepares our students for life. We are continuing to push forward with a vision that focuses on the whole child and ensures a well-rounded education for every student in the state. You can view our full roadmap to reimagining education on the URL on the screen, as well as our 2021 legislative priorities. A lot of things we're continuing to look at is looking at graduation pathways, accountability, looking at testing, looking at providing our kids with the most relevant education that they can receive, so that they can be successful, whether they go into the military, into one of our vocation or technical colleges, four-year university, or straight into the workforce. And so I think you'll be very pleased at what we are looking at and have decided to put our priorities on during this legislative session and beyond. Okay, next, please. Again, looking at the budget, what I am, looking at, and some of the things we have looked at as far as some of our priorities. I specifically want to highlight for you today, that the COVID-19 pandemic has made it clear than ever that addressing students' mental and physical health and well-being is an urgent need. And you as a body have been at the forefront of addressing student mental health, including providing funding in recent years to expand the APEX program at the high school level. And I want to thank each of you as members of the General Assembly and especially for the budget committees for this. We do believe additional funding dedicated to school counselors, along with funding for state level and school social worker and school nurse positions, would equip schools with continuing responding to our students' needs. And so that is a request here. Also expanding, I think, looking at a military family liaison position, which would strengthen, that group of students, and something that I think would benefit all of us throughout the state. Again, trying to really reach out that there's more to education than just the academic side, but providing and meeting the basic needs of our students will help prepare them and get them ready to learn in the days ahead. Okay, next slide, please. Okay, at this time, I'm going to turn this over to Russ Rome, our GOD or Godot Financial Officer, and he'll address some of the budget concerns, and then we'll address some of the information that has come up through the chats. Okay, Russ, I'll turn it over to you.
Thank you, Superintendent. Thank you for the opportunity to present the governor's recommendations for the department's budget. Foremost, we're extremely appreciative of the governor and the legislature's continued consideration of the QBE formula and K-12 funding. The budget instructions and governor's recommendations have exempted the formula and its core components from any further reductions in FY21, and we know that our districts are very grateful for this. In addition, we're excited to see the governor's recommendations include restoring approximately 60% of the austerity cuts to local districts in FY21 and FY22. This equates to about $577 million each fiscal year to our local districts. Next slide, please. Now I want to cover a few slides to give you a quick overview of the significant changes to our FY21 and FY22 budgets based on the governor's recommendations. But before we look at numbers, I think it's important to look at one of the most important factors of QBE, which is our full-time equivalent student counts, which are obtained each March and October. An FTE is made up of 6 segments, which could be multiple combinations of the 18 QBE cost categories. Each cost category is weighted differently, or in other words, funded at different amounts. Next slide, please. This slide shows the QBE FTE counts from FY15 through FY21. As you can see, we were experiencing growth from 2015 to 2018. There was a slight decline and then it picked up in 2020. Then, as many of you are aware, due to COVID-19, we had a significant decline in FTEs in our most recent calculation, resulting in a reduction of about 36,000. Next slide. This next slide shows the reductions by QBE program. As you can see, there is significant reductions in early grades, specifically kindergarten. It appears many of these students were not enrolled and may have been homeschooled. This is important because we anticipate that these FTEs will be returning. Now I will discuss the changes in the governor's recommendation for our fiscal year 21 amended budget. It is important to note that while we did see a significant FTE decline, this will not result in any funding decreases for local districts in FY21 amended because they are held harmless. Next slide, please. As you can see on this slide, the most significant changes are the restoration of the austerity cuts. This results in about $568 million restored in QBE. All other LEA austerity reductions were also restored, approximately $9 million. And as I said earlier, this budget does include restoring approximately 60% of all austerity cuts included in our initial FY21 budget. Also noted in QBE is the midterm increases for growth and charter school supplement. The final significant change to the FY21 initial budget is in our testing program. As you may recall, our initial FY21 budget was reduced in anticipation of the U.S. Department of Education waiving testing requirements in 2020-2021 school year. Our request was denied, and as a result of federal law requires us to test. This increase of $5.3 million will allow us to perform these tests and satisfy federal law. Also included in our testing budget is a one-time increase of $1.1 million in order for us to update the Georgia Milestones, GKIDS, and Keenville assessments to align with our new math and English standards. Next slide, please. Sorry. Now let's look. Next slide, please. Now let's look at our 22 budget. As I noted, the FY22 budget also includes austerity reductions to QBE of the $568 million. This restoration will put out austerity at about 4.09% of the base as compared to around 10%, which was initially used in our fiscal year 21 budget. There's also a formula increase of $114 million for training and experience in health, and an increase of $36 million in the charter school supplement for new schools. Also, there's a TRS increase of about $57 million due to the contribution percentage increase from 19.06 to 19.81. You'll notice there is a reduction to QBE of about $166 million due to the enrollment decline. This is related to the 36,000 FTE drop I noted earlier. I would like to bring up that this amount could be reduced next year when we utilize the new counts in March and October for the fiscal year 22 amended budget. Finally, in QBE, I think it's important to note that school nurse funding will be held harmless and not reduced due to the decline in enrollment in this recommended budget. The testing budget also has an increase in FY 2022 of $5.3 million, which is needed to perform the necessary testing requirements as I described earlier in law. But I would like to mention that $633,000 of this increase was funded through savings at the department as realized as a result of reducing our footprint at the Capitol and transitioning to a remote workforce model. Next slide. This last slide, one more. Oh, back, I'm sorry. Yes, this last slide shows some other significant recommendations in our FY 2022 budget. This includes a repeat of the restoring of 60% of all austerity cuts in non-QBE programs, totaling about $9 million. Lastly, it is important to note that there are LEA grants that were reduced as a result of the enrollment decline. These total approximately $9.5 million and include sparsity, residential treatment facility, preschool handicap, GNETs, and RESA grants. Thank you.
That does conclude. So we're open for any questions that you may have at this time.
I think it's up. There we go. Thank you, Mr. Rome, and thank you, Superintendent Woods, for summing up roughly 38% of our budget in about 20 minutes. So good job on that part. We do have a few questions across the room. First, Representative Chokas.
Thank you, Chairman. Superintendent Woods, this is Mike Chokas. Good to see you. I've got a question about the state chartered school. And were you still teaching the students with the handicap for the vision and for the hearing through virtual, or how did you still have in person? How did y'all accommodate those students in the state charter schools?
I think that with those, looking at the I guess diagnostic tool, I think this, of course, definitely has to be done face to face. I'm not sure. See, Matt Cardoza, he works with our charter issue. Can you add any information for Representative Chokas?
You muted, Matt. I think Matt, you're
My apologies. It's the phrase of the year, right? Sorry, I was muted. So our state charter schools are very similar to the rest of our traditional districts in that they've got everything from hybrid models to in-person models to completely virtual. Many of our state charter schools did do delayed openings after Christmas season. So many of those, if I'm looking at, they're coming back. Some of their plans were to come back in person today. And again, much like some of our traditional districts, they're having to look at COVID numbers to determine whether they can do that. And I hope that answers the question you were looking for.
I would just ask as well that as far as IDA, and again, you're talking about special, education students, and we are obligated to meet what is on their IEP. Representative Chokas will kind of reach out and find, maybe look at districts to see how they did this, but we are not immune to meeting the obligations that are presented by IDA.
Sure. Thank you, Commissioner. Thank you for, or Superintendent, thank you, Cardoza. Thank you for putting on a tie for us, Matt. It was nice to see you there.
Yeah, yes, sir.
Also, Senator Beach.
Thank you, Mr. Chairman. Superintendent Woods, how much would you say we have invested in a child that starts in our system at K through 12 when they graduate? Is it $100,000, $125,000 in the public education system?
Definitely that would vary from, if we're looking at just from a state perspective, roughly I think we invest about $8,500 per student each year, and that's statewide. Of course, that will vary as far as looking at from district to district, depending on local supplements and revenues that they put in. So, you're looking probably close to, at least K-12, probably in the neighborhood. What do you got? 10, so $100,000, $120,000, somewhere in that ballpark area.
Yeah, and I just add to what Superintendent Woods said is, within the QBE funding formula, there's a lot of variables with whether or not you got to look at whether or not it's a gifted, a regular student, kindergarten, high school, and then or special needs, and then whether or not there's supplemental federal funding associated with that child. So it can be a very, very large number.
We got one more question in the room. Looks like Representative Watson.
Thank you, Mr. Chairman. Did I hear correctly that we lost 36,000 students this past year? Was that the number?
Well, it's actually the FTEs, so it wouldn't be the 36,000 students. It's 36,000 segments were reported less. Now you could look at that and say, kindergarten, that's I believe it was like 10,000, about 10,000 students less in kindergarten, but that's from last year. So, kindergarten, we're going on what districts report to us. So if parents decided to hold their kids home and never enrolled them in school, we wouldn't have those numbers.
And we have another FTE count coming up. So we'll basically be able to give you a much better, picture. I think what we have found out, and again, my experience is traveling throughout the state, is that some parents did delay sending their kids to school. But as we continued to move forward and they found out that we were having a lot of success, they did begin to send their students into school. So, unfortunately, we cannot give you a clear count at present, but our official count, will take place once we have the spring count. So, we'll be able to have a full understanding of how many, roughly how many students, were held back. What we have found out is that many of these students that, I guess based on FTE, they do tend or have tended to come from our younger grades. And so that's where we're seeing perhaps, some of the loss at time, but it does appear to be in that segment of kids.
Thank you, Superintendent. We have a few questions online. Chairman England, if you'd like. Go ahead.
All right, Mr. Superintendent, we've got a few that have come into our chat box. One of them, Representative Belton, is just asking for you to expand a little bit on the military liaison and what that person will be doing for the military children and helping them to assimilate.
I think if we look at the military liaison position, this is a group of students that definitely faces a lot of challenges. I think that as we move forward, we want to make sure that we address those needs of our military family. A lot of them rotate into and out of the state, making sure that their transition is smooth, that they are providing a great education as they do come in, supporting families. What you'll find with them is that many of them have either one or two spouses that are deployed at a certain period of time. So a lot of I guess not necessarily hardships, but a lot of concerns about how our students and these students would be adjusting definitely needs to be taking place. And for us that, we have to invest military throughout Georgia. And as many of you know, if not all, know we have two states military, the base locations and the numerous base locations that we have throughout. I think this would also to Washington, D.C. and the branches of government or branches of the military that we are committed to looking after their children. One of the things you look at is that when anytime a military family, goes into a state, they want to make sure that their children are looked after. And I say that as a former military child. My dad served in the United States Navy for 20 years in active service, 10 years reserve. So this is something that I'm well, familiar with. And I think that, providing that and showing that we are, concerned, that we are committed to meeting the needs of our military students, sends a big signal up to Washington, D.C. I think as, we always look at this and, looking at an economic development, perspective, in case, BRAC does become an issue, we've got to show Washington, D.C. that we deserve to keep the bases here in Georgia, that we are looking after their families. And I think having an individual, whose sole responsibility is to look after the needs of our students, but also I think to expand them, that looking after our ROTC program would be a great signal, for us throughout the state.
Okay, next question up, Senator Orrock is asking, do you feel like that with the change in administrations on the federal level, that the testing requirement may change as well?
That's a possibility. I know that with my counterparts throughout the U.S., we have been having discussions of looking at what testing, should look like. There's, I guess, motivation, a lot of innovation out there, and so we could potentially see, the proposed secretary, was a sitting, state school superintendent. He understands the challenges that we all have faced in some of the conversations that we've been a part of. So definitely, I think that definitely will be something that comes up and something that we will continue to push throughout. Looking at, making sure that our tests are relevant, making sure that we're, providing a good education, not just looking at, are we testing each year just to test, and looking at, something beyond equity, but, is it, are we meeting the educational needs of our students through the testing model we have? Many cases today we've looked at, what I've always referred to as the autopsy report. Is just an annual yearly report, but, yes, within the state, we actually have a pilot going on where we're looking at formative testing, where we can measure real time where our students are and perhaps do a better job in picking them up. Because, one of the things we definitely are focused on is making sure our students move, forward, in an appropriate manner. And not just seeing them, collectively as a whole, but I think we do need to see our students as individuals. It would be great if they were all on the same page at the same time. But, if you've had a child, that is not, each one's a little bit different. And for us in education, it's no different as well. They have different home situations, different backgrounds. I think about students that, have English language learners. They come in with a different, group of challenges, perhaps our special needs students as well. So we run the gambit, and I think that, if we look at testing and doing something that is more individualized and personalized, we can come out better. But as I do look at the forward, I am very hopeful that we'll see some flexibility or continued flexibility from the new administration.
And Representative Williams and others are asking, and I know you've heard a lot about it, and we've seen it in the news, as it relates to teachers being added to the priority list for the vaccine. I know that your hands and the governor's hands are somewhat tied based on the CDC recommendations and where they fall in the 1A, 1B, 1C sort of thing, but just going to see if you had anything else to share there.
Okay, I'll turn this over to Mr. Cardoza. He's been working directly with that and can give you the most pertinent information. So, Mr. Cardoza, if you could, please.
Sure. The quick answer is that we're working closely with the Department of Public Health, and as y'all probably know, the 65 and older group was added to Phase 1A. So Phase 1B that includes teachers who are under 65. We are certainly hoping that we'll get there sooner rather than later. But working closely with them and with districts, we are looking at a task force of some districts that have some really good vaccination plans in place right now. And they are ready to roll those out as soon as possible. But again, as the chairman mentioned, we are bound a little bit by what CDC recommendations are, and right now teachers being in that phase 1B.
Thank you, Mr. Cardoza. Thank you, Superintendent Woods, as well as Mr. Russ. Rome, thank you for being present here as well. I think we've exhausted the questions that have come in online at this time, as well as those in the audience. So thank you again for your presentation, and I'm sure that the members will be following up with you individually in our subcommittee levels. Thank you for being here.
Raised, I have a question.
You got it.
Hello?
Representative Bruce, if you don't mind, do your question in the chat box.
Okay.
We're trying to limit and not be doing the, I know we've got the capability, but we're just trying to keep a little control in case somebody that's not welcome decides to show up and try to entertain us.
Okay.
Representative Bruce, we're waiting on your question in the chat box.
Problem is I don't type that fast.
No problem, thanks.
Yeah, I'll go ahead and pass because I don't want to hold everybody up, but it was a real quick question. But go ahead.
Go ahead. We have the time, and you've earned the right. Please go ahead.
To go ahead and ask it?
Yes, sir. Go ahead.
Okay. What I was trying to, when you were talking about the learning loss, I was trying to figure out if that was due to the inconsistency because, we keep taking the teachers and the class and the students back and forth. 1 week they're in, 1 week they're not in. So is it the inconsistency? And if that's the case, would it not be better to focus on trying to become experts at distance learning so that we could have consistency?
I think as you look at the various models definitely could play into part. The consistency of being in and out. As I said, we have to follow the Department of Health guidelines. But one of the things we have learned is that many of the cases that if you have a school system that is basically a virtual option with a live option, you have the capability, but also you have the experience. So we do have teachers that have been doing this all along. In many cases, what you'll find is that teachers have been teaching, online and also within on a virtual platform. In some of the cases, we have found out that you have to look at various home situations. We have some of the parental support that definitely has been an issue. Connectivity is always an issue that we look at. So I think that, in being mindful of many of the parents, or at least the ones that I've looked at, they appreciate the option. We appreciate DPH with, kind of reducing some of the wait time we have in there. And to be honest, I think that to address your question as a whole, one of the things we look at is just the quarantining. We haven't necessarily seen a wide outbreak of the virus throughout our schools, but because of guidelines, that has caused the biggest issue. But our school districts have, done a good job at providing that capability where possible. We continue to learn. This is something I think that, to say that, could we do this, throughout the state? We sports across the state. We have actually provided training for teachers how to become a virtual instructor. So that's we continue to lean and provide for our districts as well. So, we're going to have to look at everything, across the state, looking and evaluating what we have and have not been doing, to see how successful we have been. I think some of the formative assessments that I previously mentioned will help us out. Looking at learning it, as I shared, one of the things that our districts have been doing, they have been evaluating their students. And I think that as you look at evaluating those students, that comes in different forms and fashions. With the Beacon, which we provide at the state level, you can do that for a student that is learning virtually. For some of the other platforms, I'd really have to reach out to districts to see how effective that is, or do they have the capability to do that virtually as well. So some of the data we give you, we just don't know as of yet. We will kind of take this information as we go on. We make decisions for the summer. I would really just want to just say this. I think that we would hope that we have the vaccines and we can begin the next school year back to normal, where our kids are face to face, looking at options opportunities we have learned a lot during this session. But the impact of the virus, I think is definitely going to be felt for a few years to return. Hopefully, we can continue to address this, and we may have to look at our learning platforms and models to make sure that as we catch our kids up, what do they need to focus on, where that learning loss is taking place. Because each grade band, it looks a little bit different. K-5 is definitely, and I would add pre-K to that. Pre-K 5 is definitely a very important landscape, because we learn so much of our foundational skills there. High school, just because of the way it's organized, looks a little bit different. Middle school is kind of a blend. And so I think that, we look at each segment a little bit different. But, hopefully, like I said, we can get this down. But most of our kids, as I said, roughly about 70% of our kids, we have been probably close to face-to-face. So, and with most of our schools coming online, should help that out. With that being said, this virus has shown itself to be somewhat unpredictable at times. And hopefully we get the vaccine out. And again, if I'm not mistaken, Matt, the vaccine is really for our teachers and educators. I have not seen anything that says it's going to be provided for students in the near future.
That's right. For the vaccine, testing has not actually even been done, trial testing for 16 and under. So the vaccine itself would be for teachers.
Thank you for your answer. I think Chairman England had another comment coming online.
Yes, we got one more question. It's from Chairman Dickey, and he's just asking, with the governor's proposal on the restoration of QBE funds in the amended 21 budget, what do you anticipate that the school systems will be using those funds for between now and the end of the school year?
Well, definitely, I think we talked about learning loss. Trying to make sure that some of the academic gaps are being met. It may be perhaps to address continued safety concerns, PPE, for some of this if allowable. Rusk or Matt, I'm not sure if you've heard anything directly across the state on those allocations. I know, Matt, you worked with the allocations directly, so you might get better address that.
Hey, good morning or good afternoon, Chairman Dickey. Yeah, I think it's going to vary all over the place, but in terms of some of the CARES funds, of course, they've been using them for that term the feds have said is continuity of services, and of course QB I think would be the same. So many of them, are trying to keep teachers and operations going, and while the federal funds certainly help, I don't think that props them up completely in terms of what the QB difference is versus how much they're getting in the federal funds. But the learning loss is going to be, I think, the thing that most districts are probably going to be looking for overall funding for, is because just in the virtual learning realm, as was mentioned earlier, it's been a struggle for many kids. And if we find that some of our kids have gone backwards and had that learning loss, then they're going to need those fundings for not just the immediate, but in the near future.
Thank you, Matt. I think has that covered all our questions online now? We've got them online. Any more questions from anyone present here in the audience? Superintendent, thank you again. Thank you for your staff for joining us. And again, we look forward to seeing you at the subcommittee hearings that will be beginning very, very soon.
Thank you very much. Appreciate your time.
Thank you. Thank you for your time. We're about 5 minutes ahead of schedule. I don't know if we have Chancellor Wrigley on already. Okay.
Yes, sir, Mr. Chairman.
We've already got the Chancellor. If it's okay with the members, rather than taking a 5-minute break, we'll go ahead and push on through. That's okay with you, Chairman England. Chancellor Wrigley, thank you for joining us. I look forward to hearing about our university system and what's been going on.
Thank you, Mr. Chairman. Appreciate the opportunity to speak with you and the committee today about our budget requests and also an update on the university system of Georgia. More than ever, we really are grateful to you all for the support, particularly the last year and the support of the governor and his team. You've heard from the other agency heads about the challenges, and we've faced ours as well, but we've had great support from you all, and we do very much appreciate it. Tracy Cook is with me today. She's the Executive Vice Chancellor, oversees our fiscal area, and she will go into more details in a few minutes about the budget request. But I'd like to give a brief overview about the past year and where we think we stand and where we think we're headed in the coming year. From the beginning of the pandemic, we made decisions believing the virus would affect us for a year or more. We had to think long term, we felt like. Our immediate focus was to be of service to Governor Kemp and the coronavirus task force. Across our 26 institutions, we have expertise as well as supplies and equipment, all of which were needed to support the state's initial response to COVID-19. Our institutions quickly redirected critical medical and PPE supplies from their campuses to healthcare workers fighting COVID-19, including providing to GEMA and DPH nearly 40 ventilators, 20,000 surgical and N95 masks, and more than 375,000 gloves. Our research institutions worked with the Georgia National Guard to help stand up a COVID-19 testing response, and Albany State University offered housing to traveling nurses in that community's early battle against the virus. In March, we made a rapid pivot to online-only education for the remainder of spring semester and through the summer. At the same time, we understood that the potential fiscal implications of the impact of COVID-19 would be a far greater challenge for everyone. We made a decision to refund almost $142 million in housing, dining, and other fees to students and their families who could not use those services because they weren't on campus. It had a financial impact on institutions on top of the other revenue losses, but it was the right thing to do. Auxiliary operations such as professional education programs, study abroad trips, and space rentals were also canceled, bringing campus revenue losses over the 2020 spring and summer semesters to about $350 million. A portion of these losses were offset by federal stimulus funding through the CARES Act. Institutions received around $157 million in CARES money, which partially covered the cost of refunds and rapidly moving to online instruction. Another $125 million went directly to our students, as required by the CARES Act and the Federal Department of Education, to offset their own financial costs. CARES did not offset all confirmed losses experienced by our institutions, but it helped, and we are grateful for this federal support. We also understand the pandemic's impact on this state and its economy, and the need for you all to adjust to it. As a result, we originally did not receive funding for enrollment growth this fiscal year, but as you know, Governor Kemp has recommended these funds in his amended budget for the education agencies and for next year, and we are very grateful and strongly supportive of this recommendation and respectfully ask for your support. As with other state agencies, we also had an FY21 budget reduction that for us was $263 million. Nor did we increase tuition or fees, so the enrollment funds in the amended and FY22 budget will certainly help offset these revenue impacts. You all understand the importance of the funding formula for our institutions. Enrollment is up system-wide, but this comes as revenues are constrained. The formula directly supports teaching and student success across Georgia, and I would appreciate support for the formula funds that are vital to helping us carry out that mission. I spoke at the biennial last month about how people's lives have been changed by the teaching, research, and service being done by our campuses. Expanding people's horizons is our purpose, is at the core of what we do to carry out mission, to create knowledge. To illustrate, Chairman Tillery, I'd like to share a story. A policeman stopped a man in a car. He had a pig in the front seat with him. The policeman asked the driver, "What are you doing with that pig?" "You should take it to the zoo." The following week, the same policeman saw the same man with the pig in the front seat of his car again. Both of them this time were wearing sunglasses. The policeman pulled him over and said, "I thought you were going to take that pig to the zoo." The man replied, "I did. We had such a good time, we're going to the beach this weekend." When we succeed, we do expand horizons. As we went online last spring, we also quickly shifted our attention to planning a fall return to safe in-person instruction. We believe strongly that in-person instruction is best for the vast majority of students, and carefully prepared and then executed plans for their return to the classroom. We required social distancing, provided over 2 million masks to campuses, and supported testing either on campus or in conjunction with local partners. We are now at the start of spring semester. In-person instruction is continuing. Institutions are working closely with the Georgia Department of Public Health for when vaccines are available to our campus communities. Even with the pandemic, our campuses continue to teach, conduct research, and carry out public service projects while protecting health and safety. Our goals of being more affordable, more efficient, and graduating more students have remained unchanged. What we have changed in recent years is our approaches of how we graduate more students ready to work and contribute as citizens. We talked last year about the future of work and how we are adapting degrees and coursework to meet industry needs. As part of our degree review process, we now require institutions to show how a proposed degree ties to labor demands in a local community. For example, South Georgia State College recently sought approval for a new Bachelor of Science degree in mechanical engineering technology. South Georgia State demonstrated that 12 companies in Coffee and Ware counties needed some 60 employees trained in engineering technologies over the next several years. Georgia Highlands College launched a new bachelor's degree in building information modeling management to train students how to manage design information during the building construction process. It's the first degree program of its kind in Georgia, only the second in the nation, and it comes as the Department of Labor projects annual growth of 1.1% annually in construction occupations and nearly 7,100 new jobs in architectural and engineering services in Georgia over the next 5 years. We've talked before about jobs created after the Great Recession and how 70% of them went to people with a bachelor's degree. The pandemic is still unfolding, but bachelor's degree holders have now also nearly fully recovered from job losses suffered since last spring. Getting a degree rewards the individual and our state, as bachelor's recipients earn almost twice as much in a lifetime as those with a high school diploma. And those earnings will increase Georgia's gross domestic product by almost $2 million per graduate. The good news is we are graduating more students than ever. Since 2011, our enrollment has grown 7%, while the number of degrees awarded has increased 29% to almost 71,000 last year, the most in our history. The rate of awarding degrees, therefore, is 4 times higher than the rate of enrolling students. We are pleased with the success of our students, and our board is committed to keeping costs low, as that is the best way to help them complete a degree. Over the last 5 years, the average annual tuition increase in Georgia is only 0.9%, less than 1% a year, far below the rate of inflation. In 3 of the last 5 years, we have not raised tuition at all, including for the current academic year. As a result, Georgia students and families pay some of the lowest tuition and fees in the Southeast and in the nation. Among the 16 states in the SREB, we rank 4th lowest in undergraduate tuition and fees. And nationally, 36 states have higher average tuition and fees for 4-year degrees than Georgia does, highlighting the financial advantage of attending college in the USG. Inexpensive does not mean inferior. While our cost is low, our performance is high. We every year have institutions ranked among the best in the nation, and are one of only 3 states with at least 2 public universities, the University of Georgia and Georgia Tech, ranked in U.S. News and World Report's top 15. At the same time, we have become more efficient as our spending per degree over the last 6 years has declined by 7%. We have also pioneered the use of free or low-cost textbooks. The resulting savings to students are substantial. Last spring, USG students saved $27 million on textbook costs, making us a leader in the nation. And through the system's eCore program, you can take the entire core curriculum online and the textbooks are free. Our goal has been to change how we do things and make the organizational culture more efficient while graduating more students. And right now, regardless of the pandemic, that's what we are doing, graduating more students than ever and spending less to do it. We are also doing more to help students with their well-being. With support from Governor Kemp and GEARS funding, we have launched a plan this spring significantly expands student mental health services at all USG public colleges and universities. We are also pleased that Governor Kemp, as he mentioned in his State of the State speech, has set aside $5 million from the same funds for GAP scholarships for students impacted by COVID-19. The past year has presented challenges, but we have overcome them. Obstacles remain, but I'm optimistic about what is ahead. We are thinking about these challenges and, most important, acting to address them. We do very much appreciate your support. We have much work to do together, and we cannot get better without your support and guidance. We're grateful to you and Governor Kemp for your long-standing investment in the University System of Georgia, and we look forward to working with you this session. Now, Tracy Cook, our Executive Vice Chancellor for Strategy and Fiscal Affairs, will present the specifics of our budget request. Thank you.
Thank you, Chancellor. Can everyone hear me?
We can. Yes, Tracy, go ahead. Thank you.
Thank you. I have a couple of slides. Hopefully everyone can see them. So thanks, Chancellor, and thank you, Chairman Tillery, Chairman England, and committee members. And as the Chancellor mentioned, I'm going to discuss the fiscal year 21 amended and the fiscal 22 budget recommendations. As the Chancellor mentioned, the university system, thank you, there you go. As the Chancellor mentioned, the university system sustained revenue losses of about $350 million last year due to this pandemic. And additionally, like all other state agencies, our fiscal year 21 state funds budget was reduced due to declining tax revenues. And the reduction of 10% amounted to a loss of about $263 million in state funds appropriated to the USG. So our institutions responded to these reductions by finding efficiencies and cost savings where possible, but by also freezing vacant positions, scaling back on some non-essential services, and in some cases, eliminating jobs. These cuts came at a time when the university system enrollment had grown to its highest ever, making the task of absorbing these reductions even more difficult. But our overall goal sought to minimize the impact on instruction and student support. The recommendations for fiscal year 21 amended budget includes a net increase of $65.6 million in state funds for the university system institutions and its pass-through organizations. And I'll highlight each item here for your information. The first is the increase of $70.1 million for our enrollment growth and facility growth across our 26 institutions. To explain the request, I'd first like to take a minute to provide a brief overview of our funding formula as it drives this item. Almost 90% of the funds that are appropriated to the state, to the university system from the state come to us through the funding formula. And this formula is the basis for our requests each and every year. The primary driver in our funding formula is enrollment, specifically the number of credit hours that our students take. The amount of physical space on each campus is also another major driver. Credit hours from the most recently finished year are used in the formula, which means our formula is always and has always been on a 2-year lag. In fiscal year 21, the Board of Regents made a request of $70.1 million related to this growth. In that year, our students took over 8.5 million credit hours, which was an increase of about 1.3 over the prior year. But due to the uncertain revenue picture of the state, the growth was not funded in the original fiscal year 21 Appropriations Act. And as the governor mentioned, he has now recommended this growth to be added to our budget for fiscal year 21, amended and permanently moving forward. We are very grateful for the governor's recommendation to provide this funding for the enrollment growth. In years of growth, without additional state support through the formula, we are essentially absorbing a budget cut. I should be clear that these funds do not backfill the 10% budget reduction, which I mentioned earlier. Instead, they provide for the basic support for the growing instructional needs of our system, such as faculty and technology and other support services that are needed for the success of our students and help them to graduate on time. These funds help maintain quality and affordability for our students and our increasing student population. The university system's teaching, research, and public mission is a people-driven enterprise. These funds help fill or expand faculty and staff positions that are critical to instruction. Some of these positions include advisors, tutors, financial aid officers, etc., and more. And because we are halfway through the year, we will not be able to incur a full salary and benefits for some of these positions, but we also have an opportunity to address one-time maintenance and technology needs that have been deferred on our campuses due to budget reductions. This includes classroom upgrades, increasing Wi-Fi capabilities around our campuses. Additional uses of these funds in fiscal year 21 will be directed to student safety and health enhancements. Moving on to the next item, the fiscal year 21 amended budget also includes, also includes $4.7 million that was added last year to support payments by the USG to the teachers' retirement system. The teachers' retirement payments were to begin in fiscal year 21 for a subset of employees who are optional retirement plan or ORP members who were originally part of TRS. The legislation that required this payment was actually repealed subsequent to the passing of the Appropriations Act. Therefore, these funds are no longer needed and are being returned back to the state. And lastly, the Georgia Military College has received an additional $217,000 to offset austerity reductions in their prep school. Next slide, please. Moving to the fiscal year 22 operating budget, the governor recommended a net total increase in state funds of $131.4 million to support the university system. This slide summarizes the adjustments to our budget. The first three items are related to the health and retirement and impact all of the programs within the Board of Regents. This includes our teaching program and our B units. So changes in the Board of Regents health plan has actually saved money and reduced costs to the state by decreasing our employer premiums. We manage our plans by consistently reviewing claims data, negotiating strong performance guarantees, and just being vigilant in managing our vendor relationships. This $1.1 million budget reduction reflects these efforts. The next common item across all programs is the increase to reflect the change in the TRS rate from 19.06 to 19.81%. And you will see this change in other education agency budgets as well. And lastly, as previously mentioned, this is the change to permanently reduce our budget by the $4.7 million to return those funds back to the state, given the repeal of the legislation. Now I'll highlight some of the major items included in the fiscal year 22 budget related to our funding formula, or specifically the teaching program. The governor's recommendations fund $57 million for credit hour growth. As mentioned previously, these funds support increased costs associated with the growing number of students enrolled at our institutions. Again, they support hiring of faculty, advising, technology needs, and all of those things that are needed to support the student body. This increase is reflected of a 1.5% growth in credit hour production year over year. Our students are now taking upwards of 8.6 million credit hours in the given fiscal year. The next item is the state support for new academic square footage across our campuses, or maintenance and operation funds. The increase of 336,000 square feet generates about $1.9 million in state dollars. These funds are essential for the plant operations of our facilities and cover things such as utilities, custodial services, building maintenance, and other facility-related operational expenses. The next line item reflects the unfunded fiscal year 21 enrollment and M&O growth added back into our base budget that was previously discussed as a part of the amended budget. In the interest of time, I won't discuss every item on the slide, but again, you can see that the governor's recommendation for fiscal year 22 amounts to $131.4 million. Next slide, please. Now I'll talk a little bit about the capital budget. This slide shows the capital recommendation for fiscal year 22. The first item I will highlight is major repair and rehabilitation or renovation. We call them MRR funds of $70 million. These funds are used to invest in our existing facilities and infrastructure at every campus. MRR goes a long way in addressing the current backlogs of capital maintenance and updating facilities, existing facilities, to meet current educational and safety demands. These MRR funds help keep our existing buildings maintained and decreases the need for new construction. The major categories of MRR include HVAC, roofing, regulatory projects, utilities, electrical, streets, and drainage. And MRR funds prioritize toward extending the life of a building, occupant safety and comfort, and code compliance. Each year, we ask our institutions to provide 3 years of MRR projects that could be addressed on their campuses. The most recent request is actually about $250 million based on their submissions. We believe the true backlog of deferred maintenance is probably higher. Next slide, please. The next few slides will highlight major projects in the other categories, the first being construction. This recommendation includes $104 million in funding for 7 new construction projects across our institutions. These construction projects will have a direct impact on student success, and many are supported by other fund sources such as private giving or institutional dollars. And these funds help advance these projects. In the interest of time, I won't go through every project, but I would like to highlight just a few. The agriculture facilities at ABAC includes 28,000 square feet of new construction and the renovation of Chambliss Hall. The new facility would house the large-scale equipment necessary for modern ag engineering technology, precision agriculture, and forestry program operations. The Chambliss renovation will provide enhanced spaces for small-scale laboratory and service activities, as well as modern instructional space and faculty and administrative offices. This is important because ABAC's ag and natural resource programs are leading suppliers of workers with the skills, knowledge, and experience for Georgia's largest industry. At Albany State, the plan is to construct a 20,000 square foot facility for nursing and health science simulation center. The facility will not only provide state-of-the-art simulation space for students to learn, but will also create opportunities to support and enable collaboration with other USG programs operating at Phoebe Putney's Albany campus, TCSG, and private programs within the region. The facility is expected to help alleviate the growing challenges of clinical student placements in acute care settings. And the last project I'll mention, is the UGA project. UGA will construct 75,000 square feet of new space for poultry science instruction and research. And as you know, Georgia is the #1 producer of poultry in the country. UGA helps maintain this position by leading the nation in poultry science research. The new facility would help UGA continue to attract and retain world-class scholars, address emerging issues in poultry health and welfare, and further cutting-edge research for the benefit of the state's poultry farmers. This includes establishing a poultry food safety intervention strategy lab, which will be the first of its kind in the nation. Next slide, please. The governor's recommendation includes $8.9 million to provide equipment for 2 projects that were previously funded for design and construction. These projects are currently under construction or renovation, and the next phase is to now equip these facilities. Additionally, $1.7 million has been provided in the governor's recommendation for the planning and design of 1 new project. Next slide, please. On this slide, you will see the recommendation for 6 small capital projects that were included in the governor's budget. Small cap projects are typically $5 million or less. Like MRR, these projects are important as they allow us to renovate and or repurpose an existing facility to maximize its utilization. Small cap projects are generally more extensive than single MRR projects, and in recent years have helped us to accomplish building-wide renovations or repurposing, and system upgrades. Again, I'll share just a few examples. At Atlanta Metropolitan College, $3.2 million will be used to upgrade the original systems and infrastructure in the academic building, which was built in 1977. This academic building houses a significant amount of the college's classroom instruction. The project will provide a better teaching and learning environment by improving environmental conditions. In addition to the LED lighting installation, there'll be improvements to the HVAC, door systems, fire suppression, and replacement of the original system boilers. At Kennesaw State University's Crawford Hall, which was built in 1961, located on the Marietta campus, this was actually part of the original Southern Technical Institute. This $5 million project will replace the electrical system, roof, HVAC, and windows. Outdated labs will be repurposed for more practical uses. In addition to making the space suitable for academic uses at the growing institution, it will actually also lower utility costs and drive energy efficiencies. Next slide, please. Each of the projects discussed for our institutions have been developed through collaboration with our institutional leadership, as well as our Office of Real Estate and Facilities. The university system maintains a long-term multi-year capital plan, which is the foundation for the annual capital budget request. The request is designed really to meet the needs of the system, understanding the context of funding available. Our focus is space utilization and renovating facilities to meet these needs. We can provide additional information on these projects if needed and look forward to working with the legislative body on these projects. Next slide, please. This concludes the operating and capital budget recommendations overview. And I do want to echo the Chancellor's comments by thanking Governor Kemp, thanking his team, thanking the General Assembly, all of you for your continued support of higher education and the university system. And with that, the Chancellor and I will be happy to answer any questions. Thank you.
Thank you, Ms. Cook. Thank you, Chancellor Wrigley. I think Chairman England's going to start off this portion.
Good afternoon, y'all. Thank you for your presentation. Chancellor Wrigley, a couple of comments to kind of start things out here. One is our Higher Education Committee Chairman Chuck Martin has asked that I allay his thank you for your years of service and just your dedication to higher education in this state from him as chairman of our Higher Ed Committee. And then I will piggyback on that and add similarly that I certainly appreciate all the years that you have put into the higher education system here in the state, and not only there, but through your years of state government. I believe it's somewhere about 36 years now that you've been involved from Governor Zell Miller and possibly before, and through a lot of other changes and a lot of historic things that have happened while you've been a portion of state government. I just want to tell you how much I appreciate that. And more than anything, how much I appreciate the friendship that you and I have and have grown over the last 10 or 15 years. So thank you for that. I will tell you that the pig joke was just about as bad as the one that you told a few years ago about the four-legged chicken running so fast nobody could catch it. but I'll leave that alone for now. But we do have a few questions from some of our folks on the chat, and I'll ask you those real quickly, and we'll probably have a couple here in the room as well. From Chairman Rick Jaspers, he says that you may have said it and he just missed it, but in the university system of Georgia, what percentage of classes are being taught in person? And is there a breakdown by school that you could get him? And then additionally, what percentage of the dorms are occupied currently?
We can, thank you, Mr. Chairman. We can get that data. Not all of our institutions have started, and some of them have not gone through drop ed and the financial purges and that sort of thing. By the end of this week, about 23 of them will be started, and then by the end of next week, they will all be started. Then we'll gather that data, and we'll be happy to share it with you on the percentage of classes that are in person. Tracy, do you have info at hand about the dorm rooms that are occupied? We can get that, but again, it's a little bit in flux this time of year because, like I said, not everybody started, and students are still coming and going somewhat, but we'll be very happy to get you that information.
Chancellor, I believe the occupancy is close to 80%, but I need to confirm, but it does vary by campus.
Yes, if you don't mind, get that Chairman Jaspers and others, if you don't mind. And then kind of along that same lines, Representative Belton is asking if you could put the data about the affordability numbers of the university system into a slide or some kind of handout that we could give to members as well. That was very helpful.
Yes, be glad to.
And then, okay. Representative Carolyn Hughley is asking, did the pandemic bring any new efficiencies to the operations of the university system that you think will be something that will carry forward?
Well, that's a great question. We've been working on that area for a number of years. And as I mentioned in my remarks, the amount of revenue, the amount of money we're spending per degree has dropped 7% in recent years. We conducted a comprehensive administrative review of both the system office and every campus in the USG over the past 3 years to look at our processes, how we're organized, positions, all of those things. And we finished that work last year, really on the eve of the pandemic. I think, so we feel like we had made a lot of progress even prior to the pandemic. Clearly, the several areas that we have leaned on a little more heavily that will continue, the use of the digital textbooks is an initiative we've been working on for many years. The use there continues to grow. It's very important for students who choose that route. It saves them quite a bit of money, which again helps them to graduate and graduate on time. We've, I think, learned how to shift more quickly between online and in person. I do think the back and forth isn't always good, and we avoided that. We really didn't want to do that because we felt like it would be a little too disruptive. But the effort that we had made under the comprehensive administrative review beginning in 2017, 2018 really set us up well, we feel like, for operating pretty efficiently, but we know we can always do better, and we'll continue to try to do so.
We have a question in the room, Chairman Sam Watson.
Thank you, Mr. Chairman. Chancellor, in your opening comments, you mentioned that we needed to be thinking long-term. And so I guess my question is related to the continuing to require the waiving of ACT and SAT scores and how that may affect higher education long-term in the future as far as costs go, as many students may decide to skip over some of our smaller state colleges and move on up, and then having increased tuition costs. And is that going to put a burden on our state and parents and the hope going forward long term, and allow you to continue to educate more affordable and efficiently?
We made that decision based literally on what was available by the College Board and ACT at the time. Our intention is to go back to requiring it as we have and continue to require it. It was difficult to require it when students simply couldn't get the test. And so that was the reason we made the decision that we made. We did make some adjustments in the GPA and other requirements to try to avoid, as you point out, students maybe moving up in sector, and we increased it again for this next cycle. But that is not we've not made a long-term decision on that. That was a one-time decision in anticipation that the testing companies will be able to provide their testing sites and have them protected. I noticed, I think there was something today maybe in the media that the College Board on the SAT is working on still working on a digital version of offering the SAT, which would certainly help. Of course, I'm optimistic that with the vaccine and moving into the spring and summer of the year, that this next cycle of testing will be able to take place, and we'll be able to go back to require the ACT and the SAT.
Okay, Chancellor, I've got another one for you from Senator Orrock. She says, Dr. Wrigley, would a more welcoming policy for Georgia's DACA youth to assist us in increasing quality graduates, higher enrollment, and to bring kids into higher education that are barred now by requirements that they pay out-of-state tuition and are barred from our top 3 institutions? Thank you for your decades of public service.
Are you asking me, what specifically is the question?
She's, I guess, just saying if there was a more welcome or open policy as it relates to DACA students, what your thoughts are on what it might do for the quality of graduates, higher enrollment, and then also as it relates to the 3 of the top 3 institutions in the state where they're not accepting them at this point.
Yes, thank you. As you know, I think that statute's been in place 15 years or so, maybe. I'm trying to remember, something like that, 06, 08. And so it would take a statutory change. So we've not really done any analysis or examined that question, given that it would take a statutory change, and it's been the posture of the General Assembly and the governor's office since that time. Some other states take a different approach. It varies quite a bit around the country. Again, we've not looked at it in detail to try to examine what differences there are and what difference it makes. But it would take a statutory change for us to be able to do that, as I understand it.
Chancellor, I think we had a question go up, but we also had a computer go down at the same time. But I saw the question briefly. I believe it was Senator Orrock again asking about needs-based scholarships. I'm
Yes.
sorry that I could not read more of the question before it went away.
No, as I mentioned, the governor has proposed, again, it's not using state funds, but money from funds related to the CARES Act. GEARS funding is what they call it, the governor's education relief funds, has proposed setting aside $5 million from that for gap funding for students who have been impacted by COVID-19 in a way that could potentially interfere with their either continuing toward a degree or finishing a degree. And we work with them on that, and they've been great on that. And I do think it's the kind of thing, and many of you are familiar with Georgia State and some of our other institutions that have developed gap funding programs to help students of need and students so that they don't get to their 3rd or 4th year or are unable to finish a degree. Several other institutions have done a good job of raising private money. It is an important tool with respect to providing scholarship money. It does help students to get that last mile, get that last semester in. It is amazing the numbers of students who get to the 90, 100-hour mark and are not able to finish. And a lot of things happen in a student's life and career, and help explain that. And certainly one of them is financial challenges. So We're supportive of that $5 million pilot program and are supportive of those kinds of efforts.
Thank you, Chancellor Wrigley. I think you've exhausted the questions that we have that we saw online and also those that were here in the room. Let me echo the, we got it. Okay, good deal. I think we answered it. If there, let me echo the comments of Chairman England. Say thank you so much for your years of service to our state and your steady hand at the head of our university system. We really do appreciate you.
Thank you. Thank you all very much. Appreciate the support. Thank y'all.
At this time, we've got we're 10 minutes ahead of schedule. I know we've already got President Keel on the line, but if it's okay, we'll just take a brief break, take a quick restroom break, grab water if you'd like to, and President Keel will be with you just shortly. Okay, we're going to come back into order here. Do you have something, Chairman? All right. We're going to come on back. Chairman England had to go meet with a former senator really quickly. He'll be joining us here shortly. But I believe we have President Keel on the line.
Yes, that's correct.
Mr. President. Well, thank you for joining us this evening. We look forward to hearing about the exciting things at Augusta University and our Georgia Cyber Center as well. Handing the floor over to you.
Well, thank you very much, Chairman Tillery. And ladies and gentlemen, I greatly appreciate the opportunity to spend a little time with you and talk about the Georgia Cyber Center. And but before I do, please just let me also add my incredible thanks to you for all the work that you do for the great state of Georgia, day in and day out. We especially appreciate the work that you've been doing under the most unusual and difficult times I think that any of us have ever faced. And I would be certainly remiss if I didn't say how much we certainly appreciate the support you've given the University System of Georgia and to Augusta University. So please let me start by saying thank you. And I will end with saying thank you, but I don't think we can never say that enough. And I hope you never get tired of hearing it, because we certainly never get tired of saying it. Next slide, please. What I want to be able to do today is to talk about the Georgia Cyber Center. I'm under the impression that some of the members of this committee may not have had an opportunity to know much about the Georgia Cyber Center, or may not have had a chance to visit. And I'm sure you're probably asking yourself, what is this facility that you have provided support for, that the state of Georgia has provided support for? So I want to tell you a little bit about how we came to be, and then I will spend some time talking to you about the incredibly unique things that are offered at the Georgia Cyber Center. We're very, very proud to be in a state that has made this sort of investment in the area of cyber and cybersecurity. It sets us apart from virtually every other state in the union, and I hope to have the chance to be able to spend some time with you to do that. Then I'll open things up for some questions. Next slide, please. The impetus for the creation of the Georgia Cyber Center really started back in 2013 when the Pentagon made the decision and announced that they were moving the U.S. Army Cyber Command from Fort Meade in the Northeast all the way down to Fort Gordon here in Augusta. And we are incredibly fortunate as a state, but also as a community, to have Fort Gordon located right here in Augusta. It has always been a significant part of the fabric of our community. Very proud of that relationship. And we knew right away that the announcement of this move was going to change the very face of Augusta. And it was going to do it in many, many ways. And subsequently, it would change the very face of the state of Georgia as well. Next slide, please. Overall, the move has an unbelievable impact on our area. It's going to be a little over $2 billion in construction. New construction will be occurring through 2030. When it's all said and done by 2023, I'm told there will be an additional 13,200 new employees and family members, military and civilians, that will be relocating to the Augusta area. And that's going to have a huge impact on our community and our state. The actual 3-star command flag was transferred here on this past July 2020. And so the facility is up and functional, and the flag has been transferred. Now, we knew that when the Army made this decision that Augusta and the state of Georgia was going to be hit by what we're calling a cyber tsunami. Not just the move of the Army and all of its individuals, but all the government contractors that are supporting that mission will be moving to this area. And we recognize that we have a once-in-a-lifetime opportunity to get prepared for this cyber tsunami. And if we weren't prepared for this cyber tsunami, both as a community, a state, but also as a university, it was going to wash right on by us, and we will have lost this opportunity. Next slide, please. So we began to start thinking about what should we put in place to take advantage of this opportunity to support the mission of the Army, but also to translate that mission support into economic development for our state. And we began to give thought to what would it take? Wouldn't it be cool if in one facility, in one location, we can have academia, industry, and government co-located in the same building? And if you're able to see the slides and you see those footprints are intentional to help us understand that the concept here is for a student to be able to walk right out of the classroom and walk across the hall to do an internship with a major industry or business in cybersecurity, or with the federal or state government that's involved in this opportunity. What an incredible opportunity for our students and for workforce development to be able to do that. And we said, in addition to having these three partners, the federal and state government, industry, and academia, what if you put a cyber range in this facility too? So we could provide state-of-the-art training for not only to train students, but also state-of-the-art training for industry and business, and for our state government entities, and being able to address, protect, and defend against cybersecurity threats. And then what if we had a place where the Army could also be a part of this, and our armed forces, so that they could be outside of the fence in civilian space, but at the same time have space there, control space, classified space, that those sort of meetings could take place. And then what if we also had law enforcement, because obviously cybercrime is getting to be a huge issue for us. And right in the middle of this facility, what if we put a coffee shop? Now, the coffee shop might sound trivial in the grand scheme of things, but that's probably one of the most important aspects about this, because it further emphasizes the concept of collaboration. We want students and government employees and industry leaders to be able to rub shoulders, to bump into each other over a cup of coffee or in some of the shared spaces so that they can collaborate. We created an ecosystem that's hugely important for this concept to work. And we began to put thoughts together as how we could construct this, how we could build this, and what it might look like. Next slide, please. We began to have conversations in the fall of 2016, began to have conversations with Governor Deal and his staff on what it would take to create the Georgia Cyber Center. In January 2017, Governor Deal announced the formation of the Georgia Cyber Center, and through your generosity and support, $65 million was appropriated to build the first building. 6 months later, we broke ground on that first building, and simultaneously with that, Augusta University created a separate school of computer and cyber sciences to address some of the training and educational needs to meet the workforce needs here. We began to recruit a dean and faculty for that school. 6 months later, in January 2018, we broke ground on a second building because it became very apparent that just one facility wasn't going to be big enough to meet the entire needs that we had. And as we started getting the word out that we were creating this center, we had contacts from all over the country wanted to be a part of this because they could see what was about to be developed here in Augusta. 6 months later, in July of 2018, we opened the doors on the Hull McKnight, the first building, and the Governor Deal also created the Georgia Bureau of Investigation Cyber Crime Center was established in part of that facility, and I'll speak to that in just a minute. That was July 2018, and then in January 2019, we opened the second building, the Shaffer McCartney building, both buildings at about 160,000 square feet. From the start of the conversations we had until we opened the doors on two facilities totaling 330,000 square feet was 2.2 years. Absolutely unheard of in terms of being able to construct facilities in that rapid a time. It was a $100 million investment by the state of Georgia, to date, the largest single investment in cybersecurity by any state. Next slide, please. The Georgia Cyber Center is two buildings. The first is roughly 167,000 square feet, and it contains the cyber range and the academic space for the School of Computer and Cyber Sciences at Augusta University, and also training space for Augusta Technical College, I'll mention in a minute. The second building is roughly the same size, about 165,000 square feet, and contains incubator and accelerator space, and also specific office space needed. Total of about 330,000 square feet. There's control building access. There's also control meeting space, which allows us to hotel, if you will, security briefing space to meet the high security demands of government and related contractors that will be occupying these two buildings. We have a cutting edge cyber range and about a 5,000 square foot capture the flag and other cyber conference meeting space in the facility, and a 340-seat auditorium for both private and public events that gives us very unique conferencing space to meet the training and education needs of all the entities in these facilities. Next slide, please. The second building was really more incubator and accelerator space. We want to provide space for business and industry to locate to and to grow and to foster innovative and entrepreneurial companies to move to this area and to be located in this same space because we have provided ample space for collaboration. We have 10 classrooms and 11 computer labs equipped for both virtual and on-site training. In conjunction with the City of Augusta, and I am incredibly proud of the participation of our partners here in Augusta, we built an adjacent 750 space parking deck for about $16 million in collaboration with the city, and we're most grateful for that support. These individuals that we're hiring to work in these facilities, by and large, are millennials. They thrive on space that allows them to live, work, play, eat, and recreate all in the same location. The location of this facility was on some land that Augusta University owned that was given to us, 17 acres right on the Savannah River. It's beautiful space adjacent to hotel, convention space, restaurants, and access to up to 50 miles of hiking and biking trails. It is a millennial's dream come true that makes it very attractive for us to recruit business and industry here to this community. Next slide, please. Our mission is to cultivate a cyber ecosystem that combines the talent of government, academia, and private industry with the intent of providing our state and nation with a decided advantage in cyberspace. Next slide, please. In terms of the specific mission, we want to deliver affordable and relevant education, training, and help develop the region's cybersecurity workforce. But in addition to that, it's not just a glorified classroom, as important as that is, but it's also bringing expertise from across a wide variety of individuals and folks to solve very complex cybersecurity challenges and offer unbiased advice to policymakers in the state of Georgia. Next slide, please. I cannot overemphasize the important role that this cyber ecosystem plays. In fact, it is absolutely a requirement before anyone is allowed to come and move into this space and rent space that they buy into this concept of education, of training, of collaboration. The true partnership between academia, industry, and government is one of the things that makes this facility so incredibly unique and gives us the potential competitive edge that you can't find anywhere else. Next slide, please. And because of this cyber ecosystem, it was important to us that we didn't just have it classroom or just have it government or just have it industry. And if you look at the pie chart on the right, this shows you the percent occupied by rentable square feet from academia, government, and industry. Academia currently occupies about 26%, government about 37%. This is both federal and state. And industry about 37% as well. So it's fairly well split among those three entities, which you thought was very important. But in terms of lease payments, you can see that academia pays the least amount of rent or lease for this space, which makes sense, only 8%. The state and federal government, 33%, and industry makes up 60% of lease payments for the facility. We feel this is a good balance, but I think it really emphasizes the important role that we felt that having this ecosystem and the role that it would play was hugely important to us. Next slide, please. Developing the workforce is critical to this and is a huge component of what we do. But again, while we have classical classroom experience, as you would expect, we also have the opportunity to take advantage of expertise that's far and wide now located in Augusta. And a lot of that expertise is located out of Fort Gordon. We have the chance to train individuals who are interested in cybersecurity, whether it's a formal degree or an industry recognized standard, and have that training be performed by some of the world's leading experts in the area of cybersecurity, providing real life, real time, real opportunities for learning for these students and address the workforce needs that cybersecurity companies are going to need when they come to this particular area. Next slide, please. We stood up, as I mentioned, the School of Computer and Cyber Sciences. Right now, Augusta University is offering 5 undergraduate degrees in information technology, computer science, and cybersecurity, and 2 graduate degrees in this area. I've underlined the Bachelor of Science in Cybersecurity Engineering, and we're very grateful to Chancellor Wrigley and the Board of Regents for approving this degree. It is the only bachelor's degree in cybersecurity engineering in the Southeastern United States. And we're really, really excited about the opportunities that it's going to be and provide to us, offering state-of-the-art, unique training opportunities for students. Next, please. But it's not just the formal degrees, as I mentioned. We have a great collaboration with the Augusta Technical College, who also teaches courses and teaches their cyber programs in this same space. I'm told that this is if not the only, it's one of the very few buildings or spaces in the entire state of Georgia where the technical college system and the university system of Georgia are co-located in the same space, and provides us with very unique opportunities for bridging programs so that students who go to Augusta Tech for a technical component degree can seamlessly transfer, if they wish, right into Augusta University and go on to that bachelor's degree, master's, or even eventually PhD if they so desire. The seamless transition is hugely important to us, and having both of us co-located in this building makes that very easy to accomplish. Next slide, please. One of the other partners that we have that we are really, really excited about is the Georgia Bureau of Investigation. As I mentioned, Governor Deal stood up a cybercrime task force as part of the GBI. I believe you're going to be hearing from the director of the GBI right after me, and I'm sure he can elaborate on this. I don't want to steal his thunder, but I got to tell you what an incredible opportunity it is for us and what a wonderful partner the GBI is. Next slide, please. They have state-of-the-art facilities in the Cyber Center. This is one of their forensics laboratories, and it's not just internet crime or web-based crime that they're investigating, but they have the capabilities to look at any sort of device that might be involved in the crime, whether it's a smartwatch, a smartphone, or the computer in your car. They can now analyze this in this facility and be able to help solve crimes that are very technical in nature. They have been marvelous partners, and some of their agents actually teach in our programs, and they're offering internship opportunities for our students as well. Just imagine if you were a student who wanted to get into forensic cybersecurity, to be able to go to this location, get your training, and work with the GBI and real life crime, cybercrime opportunities is just incredible. So my hat's off to our good friends at the GBI. Next slide, please. Every large business or university or government function has some form of a security operations center, or a SOC, it's sometimes called, SOC. And this is a place where we can 24 hours a day in real time monitor the internet traffic is coming into our institution. It helps us in a very proactive way keep cyber attacks from occurring. This is the Security Operations Center we just recently opened in the Georgia Cyber Center. Augusta University invested nearly $2 million in setting up this facility, but we also bought into this ecosystem. It's not just a place where we can maintain security operations for the university and the health system, but it is also a teaching SOC. We have intern opportunities for our students there, and our students can graduate with a degree in computer or cyber sciences with real life, real time experience doing security operations, and makes them incredibly competitive in the marketplace. We can also offer this service to other entities, both government or private, and be able to do their security operations for this particular center too. A very novel concept, and one that we're really, really excited about. It gives us a chance to take advantage of this ecosystem, do something very unique. Next slide, please. This just very quickly shows you just a few of the partners that have already moved in. And as you glance across this, again, you see that the emphasis on industry, academia, and government. And we're already have about 90% or more of both buildings completely occupied. Of the total 330,000 square feet, we're at about 91% occupied. that's either leased under construction, or leased waiting for construction. And we're quickly getting to the point that where we no longer have additional space to expand. Next slide, please. Now, we are really blessed to have incredible executive leadership with proven experience and expertise. Excuse me. Michael Schaffer is the Executive Vice President for Strategic Partnerships and Economic Development. He leads charge on the whole program. On the far right, you see Colonel Eric Toller, just recently retired from the Army. Colonel Toller was a director of NSA Georgia here for 2 years, and he's got tremendous expertise and contacts in the field of military and government contractors with regards to for the Georgia Cyber Center. The bottom right is Captain Chris Apsey, also just retired from the military. He stood up the cyber range at Fort Gordon Cyber Center, and he has great experience in cyber range. He's now the director of our cyber range, and he's got tremendous expertise. And Sarah Reese is currently in the 61. She's director of our Workforce Academy, and our training opportunities, brings a wealth of experience with her. One of the advantages we have of being in Augusta with Fort Gordon here is that we have access to all this incredible expertise. We're not only training future workforce, but we're also hiring as these outstanding individuals come out of the armed services. Next slide, please. This expertise gives us an opportunity to do more for the state of Georgia, and we're beginning to expand into a couple of projects that I think can have real impact on the state. Some experiments, if you will, in cybersecurity. The first I want to just mention briefly is rural broadband. We all know very well that we are in desperate need as a state for 100% terrestrial broadband coverage. That's a tall order, we know that, but we are in the middle of doing an experiment. We're currently contracted with a wireless internet expert, excuse me, to perform technology survey in Taliaferro County over several months. This survey will test 5 different types of technologies and frequencies usage in Taliaferro County. And we are going to use Taliaferro County as a general representation of the terrain of the rest of the state of Georgia, with the possible exception of North Georgia, of course, because of the mountains. And we hope that this will give us a real good idea of what's the best type of technology and frequency to allow us to try to beam broadband coverage to the widest area possible. We're excited about this. And Chairman Tillery, we greatly appreciate the support and the encouragement you've been giving us to move in this direction. So please stay tuned. We hope to have some results on this in the coming months. Next slide, please. And then, of course, rural coding. How do we give rural Georgians access to the same high quality computer science and cyber education as those that live in large cities? We're beginning to do another experiment to invest in an open source platform that will allow us to provide a variety of self-paced curriculum and hands-on content. We want to develop curriculum for teachers to be able to use, whether you are in Atlanta or Albany, and be able to get that to these teachers free of charge so they can provide it to their students, whether they have internet access or not. And as we address the broadband coverage, this will give us a chance for students, no matter where they're located in the state of Georgia, to be able to beam directly into the Georgia Cyber Center and take advantage of our computer opportunities and the platforms that we have there, the cyber range and those sorts of things. And we hope to be able to get support to do this so we can offer this free of charge to anybody in the state of Georgia. Next slide, please. There we go. Thank you. And lastly, I want to just mention that the state has made one heck of an investment in this facility, and we appreciate that. $100 million in facilities, another $7.4 million in AV and networking. One of the worst things we could do is not plan to refresh this technology, both the IT aspects of it, but also the facilities. We've done 2 plans for refreshing. IT, a refresh plan based on 10 years with 3% inflation, and it's going to require us to encumber $1 million annually. And the facilities refresh plan based on 20 years at 3% inflation, it's going to require an annual encumbrance of $1.6 million. So we are in the process now of making a total annual encumbrance commitment of $2.6 million, so we can continually make sure that this facility is state of the art and that the technology we have in that facility is cutting edge. Our intent is to make the Georgia Cyber Center is self-sufficient over the long haul so that we don't have to come see you every 5 years for a small cap or something along those lines. Next slide, please. So I'll stop there, Mr. Chairman. And again, just want to thank you for the opportunity. I hope that any of you who wants will take the opportunity when things come down a little bit to come. We'd love to give you a tour. You really have to see this facility to understand its significance and to believe it. We just are so grateful for the support that you have given and continue to give. And with that, Mr. Chairman, I'll be happy to try to answer any questions.
Dr. Keel, thank you for your presentation. Thank you for running over a lot of things that we've talked about offline over this year, including forensic cybersecurity, the broadband initiatives that the Cyber Center has taken under its wing, rural coding, telelearning, and also the commitment that your university makes to another big field that we're looking at, which is forensic pathologists. So you play a large role in many of the issues we're looking at across the state. I'll have to tell you, though, I didn't know how good you guys were until you made the comment about your combined working together with the GBI at the exact time that Director Reynolds walked into the room. I don't know how you pulled that off from 100 miles away and not being able to see him, but that Cyber Center must be working pretty well to pull that off. We do have a few questions here in the audience. There's a few questions here. I think some of them came in online, and Chairman England's going to read them to you now.
Yes, sir. Good afternoon, Dr. Keel. Hope y'all are doing well down that way.
Yes, sir, Chairman. Thank you very much.
First off, this is a general comment from Representative Dominic Laricchia, floor leader, just telling everybody, our staff here and all the presenters, what a great job they've done, and that he feels very confident that we're going to be able to communicate effectively and efficiently with people all over Georgia. So I just wanted to put that on the front end. Moving on to the questions, though, Representative Al Williams saying, thank you to Dr. Keel. Your efforts have sealed the fact that Georgia leads the nation in military might and with the Cyber Center, Cyber Command. So just another comment there. Senator Kay Kirkpatrick, however, is asking, and it is, I guess, related to your comments about the work you're looking at in Tolliver County, is why are we specifying terrestrial broadband? Isn't the new satellite coverage a potential solution?
And I'll try to address that question. I may have to punt that to some of our expertise and get back with you on that. But I think it's going to require full court press in terms of providing the expertise that we're talking about here. Certainly, the cloud does represent an opportunity for data storage and those sorts of things. You've got to have access to that just as well as you need access to terrestrial broadband as well. I think the terrestrial broadband gives individuals a greater opportunity and a wider opportunity for access to information than potential satellite would. So the experiment that we're doing in Tolliver County, I think will at least let us know if terrestrial broadband is possible. And if it is, what's the best technology available? And we can, I think, get to this answer fairly quickly and fairly inexpensively without investing a huge amount of money in that. And it may very well be that once we run this experiment and get the results from these 5 technologies and frequencies, that we need to look in a different direction. And if that's the case, we certainly will. I hope that gets to what you want. And if not, we'll gladly get you more information on that.
Okay, and the next one is related along that line from Senator Larry Walker. Does fixed base wireless, when there is fiber access at an elevated structure, i.e. a silo, a radio tower, water tower, fire tower, that sort of thing, show merit for isolated rural areas? And if you could, please also speak to the EMC's efforts to provide broadband. That might be a piece that you're not really familiar with just yet.
No, you're exactly right, Mr. Chairman. I'm not very familiar with that. I certainly do appreciate that question. I'll have to punt on that one as well. The fixed base wireless and fiber, of course, fiber access is an issue. How do you get fiber to every single household in rural Georgia, which is one of the reasons why wireless broadband technologies and the way that we're going is, can you set towers up to be able to broadcast wireless technology and do that in a much cheaper way than actually trying to run fiber which has been a real stumbling block in terms of getting access to every household in the state, which is ultimately what we want to do.
We've got a question in the audience, Chairman Albers.
Thank you, Mr. Chairman. And thank you, Dr. Keel. Love all the great work you're doing, and I've seen it just bring great fruits to our state. Can you tell me how you are coordinating and working with some of the other great cyber programs we have at University of North Georgia, Kennesaw State, Georgia Tech, Columbia State, et cetera?
No, that's a great question. And obviously being in the university system, one of the members of the university system of Georgia, we are reaching out to our counterparts across the state. The university system actually has an office in the Georgia Cyber Center now, so that they can help coordinate these efforts across the state. We're beginning to look at collaborative efforts with Georgia Tech even as we speak, especially on some of the rural coding aspects in terms of coming up with more curriculum that can be utilized in both K through 12 as well as higher education. And once we get the cyber range really up and running and functioning quite well, you don't have to physically come to Augusta to take advantage of it. So any of our brother or sister institutions across the state, whether they're in the USC or the technical college system, ultimately would be able to have access to the cyber range and the curriculum that we're developing there as well, so they can train their students for whatever campus that they're in, as well as K through 12. We want to provide this sort of education all the way down into K through 12, because as you well know, the future of our workforce needs are going to be dependent on getting young people interested in this area and allowing them to get their hands on this stuff and get dirty with it, if you will, at a very early age so that they can get excited about it moving forward.
I think that's handled the questions. We may have one more from the online.
Yes, real quickly, I know we're bumping up against our quit time. Is Chairman Dave Belton asking, can you just give a quick idea, give us a quick idea of what the economic impact of the $2.5 billion yearly impact, 79,000 jobs that Fort Gordon has and is having in Augusta?
No, that's another great question. We're actually in the process of doing that economic development study even as we speak. Right now, we have in the 2 years or so we've been operational, 514 announced jobs with an additional 150 jobs affected. We'll know the exact number after several of the federal partners keep such information confidential. And once we have a chance to do a community-wide economic development study. As you know, we're being very selective in terms of who we allow to come into space so that they can participate in this ecosystem. We could go with large numbers of jobs like a call center, if you will. That's not what we really need. We need the high-tech jobs, and sometimes those companies are going to be a little smaller, but the overall economic impact is going to be larger, much larger because of the salaries that they pay. So I hope that gets to your point.
It does. And with that, I think you've exhausted all the questions. President Keel, thank you again for being here today. And thank you for allowing Mr. Schaffer and Captain Apsey at the Cyber Command or Cyber Center to work with us on various projects throughout the year, including working to expand rural broadband. That's been a huge, huge thought and a huge priority of many of our members. And their inclusion was very much a part of the success that we think we're going to have. Appreciate you doing that.
Mr. Chairman, we work for you, so we stand ready to help in any way we can, and we greatly appreciate your support.
We work, and we know we work for Georgians, and they've made it very clear this is one of their priorities. So thank you for helping us address it. We do appreciate that. Thank you again for being present here today. And with that, we'll move to our next presenter, which will be the director of the GBI, Mr. Vic Reynolds. Yes, sir. We'll have the podium mic on.
All right, thank you. All right. Will you be helping me with the slide? Great. Thank you so much. Good afternoon. Let me just take a moment to graciously thank Dr. Keel, being a former Georgia Southern. He was president of the Eagle Nation down there, and I'm a Southern graduate, so I had an occasion to meet him. Thank you for his kind words about our relationship with the Cyber Center. It's something that's very important to the Bureau and doing a lot of good work over there. So thank you for his gracious comments. I do want to just take a moment to let you know, first of all, thank you for the opportunity to speak with you. And I have with me today Mr. John Melvin, who's the Assistant Director of the GBI, Dr. Jonathan Eisenstadt, who's the Chief Medical Examiner, and Ms. Connie Buck. I know you all know Connie well. She's our CFO, so we appreciate them taking time to be with me today, and they're available in the event you or any other folks need them for any reason. Obviously, it's been a very busy year for the GBI in 2020. Besides everything that we do day in and day out, we've had an extremely busy year, beginning with the circumstances down in Glenn County in the Arbery case, where the Bureau became involved in it, on up and through the pandemic situation, the summer unrest, our assistance to the Secretary of State in a limited fashion during the election issues, and back now to the end of the year. It's been a very, very busy year, and I'm going to touch on some of the things that we did this year, besides what's in the governor's budget recommendations, on some questions that have been posed to me by various legislators over the course of 2020, and some things they were interested in. So I'll touch on those as well. But getting started on the actual budget recommendations, if you can put up the first slide for me, please. So relatively clear-cut budget recommendations. In amended FY21, there are two issues, and I'll begin with number one. That's the replacement of motor vehicles. That's a large amount of money. It's $4.17 million, but let me explain to you what that consists of. There's 70 investigator vehicles, and by that I mean the actual vehicles that our boots on the ground agents drive around the state of Georgia. There are 70 of those being replaced at a cost of $46,500 each. We're also replacing 6 bomb squad vehicles. They cost us $67,000 each, and we're rechassing 6 crime scene response vehicles at $85,000 each, and that's what totals up to be that amount of money, a large amount of money that you see in amended FY21 under the first number about the vehicles. Moving down into number 2, and it's somewhat related into the single item in FY22 as well, and they both have to do with the GBI's work regarding gangs around the state of Georgia. So let me begin by talking a little bit about number 2 in amended FY21. That's a criminal gang database. Most of you may be aware, and those of you who are not, in 2010, the legislature actually passed a law giving the authority to develop a statewide gang database. For a number of years, that sat dormant. Nobody took on the proverbial elephant in the room until we decided to begin addressing those issues at the end of 19 and early 20. We developed phase 1 of the database. We actually did not go outside of the state. We actually used the IT department with DCS, and some of you may be aware they have an extremely talented IT department there, and so they helped us develop phase 1 of the database. And what we did under that phase is we migrated about 17 to 18,000 convicted gang members around the state of Georgia through our partnership with DOC into that phase 1 database, and we began pushing it out to our users around the state. The good thing about this database is it's free of charge. It doesn't cost anybody any money, any of our law enforcement partners around the state, to use that. And so now we're ready to begin the push in phase 2. And what phase 2 is actually our partners' ability to enter information themselves. In other words, let's say hypothetically you're in the criminal gang database down in Bibb County or Lowndes County or up in North Georgia. If you're part of this database, then in phase 2, once we finish that process, those partners, once they're trained by the GBI, can begin entering that information themselves. And so we expect that database to exponentially grow from the 17 or 18,000 folks in there now to information provided by our partners. And the reason and the thrust behind this database is so in the event you're working a gang case in Muskogee County in Columbus, and you want to know whether or not that individual who you're working a case on has a prior gang connection anywhere else in the state of Georgia, then through this database you can find that information out and be connected to that particular investigator, whether or not it's in Cobb County or Chatham County or wherever it may be. And so that's the purpose of the database, and we're very excited about that. We believe it's going to really help law enforcement. And that cost under item 2 centers around extending and expanding the database into that next phase. Ironically, the single item in FY22 is also connected to that, and those are 3 positions to support the legal division and the task force. If you could flip up the next slide for me, please. Thank you. A little bit about the history of what we've been doing there so I can tie in both the FY22 matter and the matter in FY21. The GBI Gang Task Force is something that hit the ground running pretty strong in the summer of 19 to begin working gang cases around the state of Georgia. Primarily, initially, the thrust of that task force was up in North Georgia simply because we wanted to make sure it was working the appropriate way, and we kind of had a hands-on approach. And so the task force was based here in the metropolitan area and began working cases from Atlanta northward. We soon expanded that down to the middle Georgia corridor. We sat and worked with the sheriffs both in Bibb County and Baldwin County to work that Macon Milledgeville corridor, some areas that we were really concerned about, some gang activity there. And so we began expanding our task force down into the middle Georgia area as well. But to make sure that no area of the state was left out, what we've done is we've actually trained agents in all 15 regional offices, in the 4 regional drug enforcement offices, and in our specialized units to make sure we had a regional gang specialist no matter where you were in the state. So if you're in Coffee County at Region 4 office of the GBI and somebody there needed an individual who was a regional gang specialist, they have access to one. So we've tried to do that and spread it out across the entire state of Georgia. We've actually developed and implemented and trained all of our boots on the ground agents in the GBI on how to work gang cases, the way to work them appropriately, a way to use the criminal gang statute here in Georgia. We've also been fortunate enough to be asked to provide training to various magistrate judges in the state, several offices that we've been brought in to train them on the statute, as well as some of the DA's offices in the state. And the GBI is currently working with Post, Director Ayers at Post, to develop and implement a statewide training course there regarding criminal street gang investigations, prosecutions, and testimony. And I'm very proud of the fact that in partnership with the Georgia Gang Investigators Association, we've reached out and trained and spoke to over 3,000 law enforcement officers around the state of Georgia on how to use this very strong and powerful gang statute that the legislature developed, and also how to use this statewide gang database, not only in phase 1, but hopefully in phase 2 as well, if the budget goes through as requested. The second area that I want to touch on with you a little bit regarding the gang activity and the gang cases concern itself with a request of FY22, and that's the addition of 3 folks to the legal department of the Bureau. For years, the legal department in the Bureau basically did a single function, and that was to advise and kind of counsel the individuals at the Bureau regarding legal issues that may pop up. Well, we discovered as we began pushing out our gang task force that there were some areas that when our agents would work cases, particularly long, complex gang cases involving multiple defendants, that we would have a little bit of difficulty. The local DA's offices just simply didn't have the manpower to handle those type of cases. And so last year, the legislature graciously gave the authority to lawyers in the GBI where they could be sworn in to help local DA's offices to help prosecute those cases. I do want to report back to you that we're currently handling over 100 defendants around the state of Georgia who have been indicted on gang cases. The GBI folks are doing that to assist the locals, including a large case, several large cases up in North Georgia, one in Middle Georgia, one in Macon. And so we're very good, very happy and very honored to humbled the fact that we can assist those local DA's offices around the state to expand their ability to prosecute and handle those cases. So that centers around what we're looking to do regarding the amount of money requested in FY22. If you could flip the next slide for me, please. Thank you. I also want to touch a little bit on our HEAT unit. It's a brand new unit that we developed in the course of 2020 regarding the issue of human trafficking, both sexual exploitation trafficking and labor trafficking. Labor trafficking was an area that in looking back over the course of the Bureau's history, we just had not spent a great deal of time and effort on, just simply because of everything else we were doing. And so we developed a unit within the GBI, acronym is HEAT, H-E-A-T. And the focus of that particular unit is to work commercial sex trafficking and labor trafficking. I want you to know that we hit the ground running on that as well on July the 1st of 2020. And we've already been working up to 55 separate investigations, 9 of which have centered around specific sex trafficking, 4 around the labor trafficking issue. We have 10 we're reviewing right now for the possibility of getting involved. And in 32 cases, as a GBI frequently does, we've assisted the locals on those particular issues around the state. So that's another unit that I'm very, very proud of. It's a brand new unit, and they're doing great work around the entire state of Georgia. Next slide, please. I also want to touch on a little bit about some questions that I've been asked about officer-involved shootings. That's always an extremely labor-intensive area that the GBI is involved in. This past year, we worked 96 officer-involved shootings and 30 use of force cases for a total of 126 cases. Last year, in 2019, on the officer-involved side, that increased by 12. We worked 84 in 2019, so the numbers shot up. Interestingly enough, out of the 126 cases that we worked involving either officer-involved shootings or use of force cases, that encompassed or occurred in 63 of the 159 counties in Georgia. So hopefully you were blessed enough to live in one of the 96 cases where that did not occur, but in the other 63, we did work those cases. Interestingly enough, out of the 126 counts or cases that we worked, 45 of those, or 36%, occurred here in Region 10 in the metropolitan Atlanta area. And so it's a very busy area here for Region 10 and working both officer involved and use of force cases. That's a very, very demanding investigation that we do. It's use of force would be virtually chokeholds, any type of physical force used on someone that got reported by the individual against whom the force was used and an investigation was done. And so it could be a number of separate uses of force, but it could be a taser, it could be things of that nature, chokeholds, all of those are encompassed within that use of force. And we were called out to do those 30 times. All right, next slide, please. I also want to report to you, I know I stood with you last year and told you that we have to do something about the backlog in the crime lab. I told you that it was an extreme concern of mine. It was at the very top of my list in 2020 to address. As I stood before you this time last year in the crime lab, we had a backlog of 44,000 cases. That number actually shot up to 46,000 over the next couple of months as we began really putting our nose to the grindstone. And as I sat down with the new director of the crime lab and assistant director Melvin, and I had a number of conversations about what can we do to do something about those numbers. I'm happy to report to you, and I'll tell you why in a moment, that as I stand before you today, that 44 to 46,000 case backlog as of January the 12th is down to 24,000 and some numbers. That's still too high, but I'm very proud of the fact that we've cut those numbers down some 20,000 in the course of 2020. We did that in several different ways. One is we did a really top to bottom search of the cases that we had in the crime lab about what we were doing on them. There were a number of cases that we had that we just simply should not have anymore. The age of the case, the various requests. And so we began sending some cases back to our law enforcement partners saying, do you still want us to do anything? I'm very happy to report to you that of all the cases we sent back, not a single one was sent back to us to say, do something, because we were clear with our partners that if you still need something in these cases, let us know. And no one has. I will also tell you that, and this is a big thank you to the folks in this room and to this legislative body, that outsourcing works. It's something that we're using in the crime lab. We need to use more of that, and we plan on it. And you all have helped us with that, and we sincerely appreciate that. As you can see by the chart, the backlog still consists primarily of two areas. Over half of the backlog, 62%, is in one area, and that's drug identification. Just identifying what kind of powder this is. Is it methamphetamine? Is it cocaine? Is it heroin? Is it fentanyl? And so that's where the majority of cases are. But if you combine that with forensic biology, which is DNA, those two areas together encompass 87% of the backlog in the crime lab. And 62% of that lies in one area. So obviously, as we begin outsourcing and continue to outsource, that's where we need to outsource. And we anticipate with the money that you all have provided us, us sending out additional cases. In fact, we've got another 2,500 cases in the drug identification chemistry area that we anticipate sending out between now and March 1 of 2021. So again, we'll be sending out those numbers, and we appreciate that. We also have the DNA backlog reduction grant. We'll probably send out close to 1,400 DNA requests to the partners that we have in the private sector to help us with those. And so I will tell you unequivocally, categorically, that outsourcing is a great help, and we've got to be willing to do that. We've also got to be willing now, once we've plucked the proverbial low-hanging fruit in the crime lab and we've started cutting those numbers down sizably in a year, is now for us to make some really tough decisions in that lab about how we do our business. And by that, as I've told Assistant Director Melvin, during the course of the next 60 days or so, we're going to be sitting down with every department inside the crime lab. We're going to be working very closely with them about how we go about now taking even further steps to get that number down even more and more. One of the things that I told the employees of the GBI is that the mission of that bureau stays the same day in and day out. But the vision I have for the GBI is to be the absolute best investigative agency in the United States of America, not the second best, and not one of the best, but the best. We cannot do that with those kind of numbers. We can't do it. And so I'm so proud of the fact that in the course of a 12-month period of time, by putting literally by working very, very hard, by doing the things that we needed to do, we've been able to literally cut that from about 46,000 cases down to 24 and some change. That's a good first step, but it's not the final step. And so we'll continue, and I will commit to you again, as I committed to you last year, that hopefully when I come back here, God willing, next year, that we'll have even better numbers to report, and we have to stay on top of that. We have new scientists coming on with us. I believe we have around 14 or so coming on with us by April, which will help again. And again, I thank you all for allowing us the budgetary ability to do that. We wait on graduation normally to bring young scientists on, so we'll hopefully have a good number of those people joining us sometime around April to again begin pushing numbers down. Our training is so intense at the crime lab because of the criteria and expectations we have that it takes a while to get those people on the ground running. But we're beginning to look at different ways to do that as well. Should we train, for example, a drug chemist, train them to do at least one type of drug where they're qualified to do a single drug before we move into training them on every other type of drug. In other words, if we train somebody and say they're certified to test for cocaine or methamphetamine, which is our #1 drug in Georgia, should we do that and then release them and let them go about training, let them go about testing methamphetamine cases? And so we're thinking about every avenue that we can at the Bureau to begin retooling, readdressing, relooking at the way the crime lab acts and conducts itself and does its business day in and day out. We've taken a good, strong first step. I'm very proud of the work they've done over there, but I do want you to know categorically that we are not through with that. We're still tinkering with it. And we have to balance that again with the fact that the standard that's required of us around the state of Georgia. As a former trial lawyer myself, I will tell you that these individuals, along with the medical examiners, often make or break a case. And so it's extremely important that their credentials, their qualifications, their background is impeccable. And so we have to continue to balance those high standards with the fact that we've got to push the numbers down. But I did want you to know and hear that from me that we're pointed in the right direction. We've come down some close to 20,000 cases in the calendar year, and so I'm very proud of that. To be candid with you, the lack of the need of testimony, since there's no trials, has helped us as well. It's very difficult for a scientist to begin something and then be called out to another county and have to sit there the entire day before they testify. It takes away from their ability to work. But we really worked with their schedules during the pandemic. We allowed them to come in at different hours, worked around them so we could have as few people in the lab as possible at one time, and it's worked. And so I'm very proud of the direction the lab is headed. I also know too, although it's not part of the budget, there's been a great deal of questions both from individuals present with me today and online too about the medical examiner's office. I'm certainly ready to speak about that in the event, Mr. Chair, either Chairman Tillery, Chairman England, you want me to do that as well. But as far as the budgetary matters are concerned, that would be all I would need to address today.
Thank you, Director. We have several questions, and we'll start rolling into those first, and we may get to the points you mentioned at the end in just a second as well. First question, and President of the audience is Chairman Albers.
Thank you, Mr. Chairman and Director. First, thank you for the exceptional work. I think the GBI is already the #1 in the nation, if not the world. One question I do have, we've seen in the city of Atlanta specifically an extraordinary and very concerning increase in murders and violent crimes. In fact, I read something not too long ago that showed it was actually worse percentage-wise in the city of Chicago. Is the city of Atlanta reaching out for the help of your team and your department in order to assist them to bring this under control?
I will tell you, Senator, that in the spirit of being extremely candid and full disclosure, in prior history, the GBI has not worked that closely with the city of Atlanta. As you know, we are an assisting agency, and so other than in some very limited areas, drugs, major cargo theft, crimes involving children, we have to be asked to do anything anywhere in the state, and that has not occurred in the city of Atlanta. Now, that doesn't mean that's the only place it hasn't occurred. There's other places too, and most of those are larger metropolitan counties because they have the manpower and the ability to work cases. But I will tell you this, Chief Bryan and I have started developing a pretty close relationship. We've broken bread together. He's reached out to us. In fact, our gang task force has been asked to come in and work cases with the city of Atlanta. That has not happened before. And so some of the cases, without speaking too much out of turn, it was a case, we got a little bit of media coverage in the last couple of weeks on some arrests, one of which involved an individual in the entertainment business. That case was worked by APD along with the assistance of the GBI gang task force. That hasn't happened before. Chief Bryant has indicated to me that he anticipates working a very close relationship, a closer relationship with the Bureau. I'm very excited about that. I think it's going to happen. And I anticipate us working even closer with them as the future unfolds. To this point, that we've not had that kind of relationship with them. Again, that's not the only large department we haven't, because most of our work is done in all candor, with exception of officer-involved shootings and a few other types outside of the metro Atlanta area. But I will tell you that I firmly believe, and I've shared this with the chief, and I've shared it with other folks too, that I think the GBI as a force multiplier with APD could do a lot of good work here. And so I'm hoping that that will in fact happen. And I believe in fact, based on my relationship with the chief and the fact he and I have spent time together and had some discussions, that in fact will begin happening.
I think got some questions online that Chairman England's going to hit first.
Okay, first one's coming from Senator Orrock, and let me back up for just a second before I get her question. Just remind those that are sending some questions via text that it's for the committee members only. So if you're not on the committee, please send your question to a committee member and ask them if they would to ask it. We're just trying to maintain the standard that we set for all other committees and in the operating process. They are not trying to be ugly or cause any problems. Just want to let everybody know that. So Senator Orrock's question is, what steps do you expect the GBI needs to take regarding these militia or emerging militia formations in our state in light of the recent U.S. Capitol uprising?
I would tell, pardon me, my manners, is it Representative Orrock or Senator Orrock? Senator Orrock. I would tell Senator Orrock, and thank you for her question, that we consistently, through our GSAC unit, that's our Georgia Intelligence Sharing and Analysis Center, we continuously monitor various individuals and groups through social media and other outlets, which I'm not going to get terribly deep into here, but that we monitor those individuals and groups 24 hours a day, 7 days a week, 365 days a year. We have a watch desk that operates continuously where we receive tips continuously all the time about various individuals and groups, that we send those out to the locals to make sure that they're aware of any situations that occur. I will tell you that that unit, the GSAC unit, within the last month has been named the top fusion center in the entire United States. It's the #1 fusion center over our great country. And so I'm extremely proud of the work they do. They constantly are feeding intelligence to the locals, to our state, to our federal partners. I was recently with the FBI special agent in charge in the state of Georgia. He was telling his superiors in Washington that he had never seen a closer working relationship than we have right now between our federal and state partners. You literally can go in GSAC, see them working together. You wouldn't know who's an FBI agent, who's a GBI agent. We also, Senator Albers, to kind of touch on something a moment ago, we have started embedding some of our GSAC individuals in the Atlanta Police Operating Center. When that operates on any issues within the city, they've been gracious enough to allow our folks to come in there and assist them. So I would tell Senator Orrock that I feel very, very good about where we are intelligence-wise on any group that would pose any form of threat to any citizen of this state, and certainly any building, Capitol building, anything of that nature. You know, there's no crystal ball, and Lord knows I don't want to jinx this, but I will tell you that my relationship with Colonel Wright, his folks at State Patrol, Capitol Police, again, our relationship with FBI and our federal partners, and our burgeoning relationship with APD, I think we're probably in as good a position as we've been here in the state in a long, long time.
Good deal. Okay. Next is from Representative Scott Holcomb. Just asking, doesn't need something you need to answer right now because you may or may not know, but anyway, just asking, can we get some granularity on the backlog of sexual assault kits, numbers, and average time frames for processing?
Yes, I know Representative Holcomb's worked extremely hard. That's one of his areas, and we've appreciated and respected his work in that area, and it's something that I've indicated to him I'm always concerned about. What I will do is sometime tomorrow, if he doesn't, Scott doesn't mind, I will reach out directly to him and I'll give him all those numbers, including a time frame, so he'll have that. He and I can address that together.
Very good. Next are a couple of comments. One is from Senator Dean Burke, just saying he's looking forward to working with the GBI in partnership with the Healthcare Workforce Board in partnership with Chairman Parrish on the medical examiner issue. And I know we've got, let me read one other comment and then we'll just ask you to touch real quickly on the medical examiner issue. The other one is from Representative Carl Gilliard, just saying he wanted to commend you on the outstanding job that you and your department have done in reference to the Glenn County and statewide in reference to the gang element. And just saying he appreciates there. That other part he might need to ask you offline, so I'll just leave it there.
All right.
And so kind of back to the medical examiner issue, if you don't mind, touch on that real quick.
Yes,
We've got a couple of folks here that in the room that have some
questions. Yes, I'll be very quick. May I trouble you to put my next slide up, if you would? I actually have some information that may help understand a little bit about where we're at.
I think it was down there. We may not be able to.
That's all right.
See.
I can.
Hey, there we go.
Yeah, one. I think let's flip the next one if we could. Yeah, thank you so much. I will tell you that this is obviously, as I've expressed to some of you folks, an area of concern for the GBI. We began seeing it a good while ago, and it certainly came to light this past summer and fall regarding the situation in Macon. Some of you may not be aware, the National Association of Medical Examiners recommends that forensic pathologists have about no more than 250 autopsies a year. That's what they recommend from a professional perspective that those individuals should do. As you can tell, as you begin looking at the chart to the right in CY, in year 17, 18, and 19, we were right at that 250 or so number. This last year in 20, that shot up over close to a little over 100 more autopsies per year per doctor. We're at 356 average autopsies a year for our medical examiners. Now, the reality is we have 3 vacancies. And some of you, I didn't know this, and Dr. Eisenstadt has really done a good job about educating me about the national shortage of forensic pathologists. We probably have 500, 550 forensic pathologists in the United States for 3 times those jobs, or at least 2.5 times those jobs. And so the numbers just don't work. And so one of the things that we've really tried to do is we've tried to figure out some way that we can not only recruit doctors for the GBI, but to keep them here. And if you'll flip me to the next chart, I'll show you what I mean by that. Just in the last 3 years, from 17 to 20, our autopsy numbers have went up almost 1,000 numbers in cases. I think it's 800 and some odd cases from CY17 to CY20. They went up almost 600 from last year to this year. And the consultations, and what that is when doctors and ME and investigators and folks have to sit down with folks and go over very complex cases and decide what happened. That's a picture up there before pre-COVID of them working on one of these consultations, trying to decide literally what happened in a case. So they do that almost as many times as they do autopsies. And that's, that type of work, that volume of work is a tremendous, tremendous burden on these doctors. Let me see the last chart here, and I'll tell you, show you kind of really up front one of the issues that we face at the Bureau. If we could flip to the next one, please. Thank you. I want you to look over here. Let's look at the associate medical examiners, and those are just individuals those are doctors who literally do most of the cutting day in and day out. I told Dr. Eisenstadt just to take some random areas and put up there about the amount of salary that we pay those, and you can see that GBI is at the bottom. When I was a DA in Cobb County and we decided to retool the medical examiner's office, we began by hiring 2 medical examiners to operate. They're now up to 3 in one county. And so what Cobb County did, and I'm ashamed to admit I was part of that hiring process, is they came down to the crime lab, to the medical examiner's office, and they hired 2 of them. They paid an associate medical examiner $60,000 more in a year to go up the road 25 miles to work in a single county for less cases. Now, my only concern, as much respect as I have for Dr. Eisenstadt, is I'm surprised he didn't go. And the chief medical examiner there, an individual who worked for Dr. Eisenstadt, who was one of his doctors, was hired up there as a chief medical examiner and immediately had a higher salary than the man who he had worked for at the GBI. We've got to have. We need some help. It's my goal, it's Dr. Eisenstadt's goal, to make sure we have medical examiners, obviously not only at headquarters, not only at Pooler, but at Macon as well. And so we've got to find a way to put somebody in Macon. This week, Monday, yesterday, at headquarters, Dr. Eisenstadt was supposed to be off, but yesterday, 53 new cases at headquarters. 53. Now they've got to do those. There's families waiting on those bodies to get back to bury them. And the reality is we've got to I told Dr. Eisenstadt, and he agrees with me. I think if we get some help for these folks, I give you my word, I commit to you, we'll recruit the hell out of them. I'll do whatever it takes. I will go wherever I need to go. So will he. And we will get these folks here. We've got a guy right now in Florida we're talking to. We've offered him a job, a pathologist from Florida, but so have 2 other areas. I guarantee you, I don't even know where the areas are, but I guarantee you, without any equivocation, we're the lowest paid. I don't have any doubt. I don't have any doubt we are. And so that's what he faces when he goes out and recruits. We've got a young lady we're praying will come on with us when she graduates this summer. The reality is that she can go anywhere in the United States and work. And I don't say that flippantly. She can go anywhere in the United States and work. And most of these kids coming out of school have $200,000, $250,000, $300,000 loans. And the Dr. Eisenstadt, I cannot begin to tell you what kind of medical examiner he is and what his reputation is, what the reputation of the GBI medical examiner's office is. And that in and of itself sells a lot of people. But standing alone compared when you can go down the road, when you can drive to Fulton, when you can drive to DeKalb, and find yourself in a better position, that's tough to compete with. I don't want to mislead you. And that's what we're faced with and what Dr. Eisenstadt and his crew is faced with day in and day out. I think last Monday or the Monday before, we had 54 new cases at headquarters, 9 in Pooler and 4 in Macon. We have 2 part-timers helping us in Macon. I don't know how he found them, but Dr. Eisenstadt found 2 part-timers who are willing to help, but they won't do homicide cases. They said, we don't want to go back and testify. We don't want to get on the road. We don't want to go back into court. And a lot of our cases are homicide cases. And so that's what we're butting our heads up against. And I don't want to, I just want to tell you that, I respect and I appreciate so much you all. Several of you have reached out to me and asked what you could do to help. And I just want you to hear again from me and from my lips, and to have Dr. Eisenstadt here, that if we get some of that assistance, we will do the rest of it. I promise. We'll tote the water and we'll go wherever we need to go to get folks. He's had Emory personnel into the ME's office recently to begin fostering a relationship with them. He's had conversations with Mercer. Thank you, Representative England, for helping us with that. And Senator Tillery, he's reached out to them and developed a relationship with them. With Augusta, and we need to do that with Morehouse as well. We need to find these young doctors who are willing to go into this field and get them here and hopefully lock them down and keep them. And so again, it's not my nature to whine. I'm not a whiner, but I apologize if it sounds that way. I just want you to understand the position we're in at the ME's office.
Thank you, Director. We have one question from the audience. Chairman Anderson.
Thank you, Mr. Chairman. Director, thank you for coming today and
yes, sir.
Sharing with us. My question is, and you kind of touched on it right at the end, would we possibly be able to reopen the crime lab in Augusta?
I'll be candid with you, sir. I don't see that happening. I don't want to mislead you. I wish, this is what my wish was. My wish would be that we had it open in Somerville. We had it open in Augusta. We had it open in every place that we've ever had. It would make our life at headquarters easier. But the reality is, for example, finding individuals to put there and to supervise them. I don't want to tell you a story. I don't see that as something that the Bureau is pushing right now. Would we be willing to talk about it and discuss it? Absolutely. Absolutely. But that's not something right now that's on our radar.
Thank you again, Director. Last question from me would be, I think Chairman Engel may have one after. You showed a slide earlier with about 15,000, your backlog of 15,000. The vast majority of that was in one area. It looked like it was a drug-related testing. Obviously, hiring your analyst or your lab technicians from that field is much cheaper than hiring your medical examiners. How many, what can you tell us the average cost if you had to hire some people into that field to knock down that backload, what the average pay there would be and what you'd be looking at?
Connie, can you help me with that? What the average? Yes.
Gotcha. And just for those listening online, it was 44,000 plus fringe. Thank you, because as you talked about, you've knocked out a lot of your low-hanging fruit. We want to help you as you're addressing the medical examiner issue. Continue to knock out the big areas, which may be your next lowest level fruit.
Yes, sir.
Continue working forward. Chairman England.
Okay, we got one last online question, and it comes from Representative Carolyn Hughley. In regard to your proposed outsourcing for backlogs on those testings, is any outsourcing going to the university system or private colleges like Emory or Morehouse? Or is there something that keeps that from happening?
Yeah, what we did is, in order to outsource, the first goal we had to achieve was to find a lab with the same standards of certification that we have. And the reason why is because these cases are all criminal in nature. They're going to be prosecuted in a court of law potentially, or infringe on another individual's freedom. And so we made sure we found private labs or any labs that would qualify with the same standards as we did. Right now, that outsourcing is being done to private labs. If we found, and I'm sure we've looked, I apologize, I don't know, I can address it to her specifically, but if we found a lab, particularly a close by lab, particularly one that was associated with the state that had the same standards we did, we would certainly discuss the possibility of doing that with them. But right now, that outsourcing is being done with private labs.
Director, I think you've exhausted the questions that we had both in the room and online. Thank you for being here.
y'all.
Thank you to your staff as well for coming and being a part of
Thank you.
today.
Appreciate it. Good to see you. Thank you.
With that being said, Chairman England, go ahead.
Just one comment. I know folks want to go back and look at some of these presentations, either today or in the days following today, but just let you know that they will be posted online to the General Assembly's website, probably sometime this evening on the presentations that have been delivered today.
Thank you, Chairman England. Once again, I want to say thank you to House Media Services, Betsy, DJ, Justin, Michael. You've been here with us all day. Michael is an intern at Georgia State who's working with the House Media Services office. Michael, you keep doing as good of a job as you did today. You might have a job before the end of this week. Just stay with us through session, we ask. That's right. Members, remember, we will begin again tomorrow morning at 8 a.m. sharp. Thank you for joining us today, and we look forward to seeing you again tomorrow. Our first presenter will be at 8:05, and that will be Commissioner Ward from the Department of Corrections. With no further business, we will stand adjourned.